Accountability Board for the fiscal year ended 31st of March 2021, as required by sections 14 and 15 of the Bermuda Accountability Act 2011.
Thank you. The next is in Premier's name as well.
Yes, Mr. Speaker. I have the honor to attach and submit for the information of the Honorable House of Assembly the audited financial statements for the Bermuda Public Accountability Board for the fiscal year ended 31st of March 2021.
Thank you. And the next as well.
Yes, Mr. Speaker. Thank you. I have the honor to attach and submit for the information of the Honorable House of Assembly the 2022 annual report for the Bermuda Deposit Insurance Corporation. Thank you very much, Mr. Speaker.
Thank you. The next, I believe, is in the name of the Minister of Economy and Labor, Minister Hayward.
Good morning, Mr. Speaker.
Good morning.
Mr. Speaker, I have the honor to attach and submit for the consideration of the Honorable House of Assembly the Bermuda Immigration and Protection Prohibition of Entry Number 2 Order 2023, as made by the Minister responsible for immigration in exercise of the power conferred by Section 26 of the Bermuda Immigration and Protection Act 1956.
Thank you. And the final is in the name of Minister of Cabinet Office and Tourism, Mr. Campbell.
Thank you, Mr. Speaker. Mr. Speaker, on behalf of the Premier and Minister of Finance, the Honorable E. David Burt, I have the honor to attach and submit for the consideration of the Honorable House of Assembly the Government Fees Trademarks Regulations 2023, made by the Minister of Finance in exercise of the power conferred by Section 2 of the Government Fees Act 1965.
Thank you.
Thank you.
Members, there were all the papers and communications. We'll now move on. Petitions. There are none. Statements by ministers and junior ministers. We have 7 statements, I believe, this morning. The first is in the name of the Minister of Labor and Economy, Minister Hayward. Would you like to present your statement?
Mr. Speaker and honorable members, later today, I will be laying before this honorable House a bill entitled the Employment Protection of Employee Tips and Other Gratuitous Amendment Act 2023. Mr. Speaker, the government continues to progress legislative amendments that strengthen the rights of workers within the workplace. The proposed amendments to the Employment Act aim to provide protections to employees who receive tips and other gratuities. The amendments will ensure that the practice of employers retaining tips and other gratuities earned by employees is discontinued. Mr. Speaker, the Employment Act 2000 sets the minimum requirements for employment relationships within Bermuda. However, despite the recent amendments made to this act, there remain areas within the legislation that are out of step when compared to examples in other jurisdictions and are not in keeping with the International Labor Organization's standards for best practice. Specifically, Mr. Speaker, currently there is no provision under the Act for the protection of tips and other gratuities in the workplace. As a result, there is no recourse for employees who do not receive the full amount of tips and other gratuities owed to them, reflective of the services they provide. Mr. Speaker, the ministry has been made aware of establishments that permit employers who do not participate in the provision of service to share in the distribution of tips and other gratuities. It has been an ongoing concern regarding instances reported where employers take from a tipping pool and other gratuities and put money that should be going to their employees into their employer's business. As a result, workers' tips and gratuities are being reduced when they are made to share with others who should not be a part of the distribution. Mr. Speaker, when drafting the amendments in relation to these concerns, the view of the Department of Labor, who receives and addresses these complaints, and the Labor Advisory Council, a cross-section of employers and employee representatives, were sought and considered. Mr. Speaker, the amendments include provisions that seek to define tips and other gratuities, protect against the withholding of tips and other gratuities by employers from employees, establish measures to ensure employees are aware of their employer's policy as it relates to tips and other gratuities, and provide the necessary safeguards to ensure employees receive tips and other gratuities earned to them where provided. Mr. Speaker, These amendments, as they pertain to all employees who commonly receive tips and other gratuities, or who work in an industry or sector where employees commonly receive tips or other gratuities, will ensure that there is a clear written policy statement providing for how tips and other gratuities are to be managed. The policy statement must be presented to each employee on the commencement of his employment, and there shall be procedures to assist every employee in understanding the policy statement. Mr. Speaker, an employer who contravenes this act in this regard will be liable to a civil penalty as may be imposed by the Department of Labor's manager or the tribunal. Mr. Speaker, it is envisioned that this amendment will have a positive impact as it will ensure employees' tips and other gratuities are managed appropriately and that employees have a clear understanding of how their tips and other gratuities are distributed. Thank you, Mr. Speaker.
Thank you, Minister. Members, the next statement this morning is also in the name of Minister Hayward. Minister, would you like to proceed with that one?
Mr. Speaker and honorable members, later today, I will be laying before this honorable House amendments to the National Training Board Act 1997. Mr. Speaker, amendments to the National Training Board Act 1997 will provide for a newly named National Certification and Apprenticeship Board that would strategically focus on skills, trades, certifications, and apprenticeships. Bermudians must be given a fair shot at the opportunities that exist today. Preparing Bermudians with skills to enter the job market is a key step in getting our people employed. Furthermore, given the need for people to become qualified to work in trades and other industries, it has become evident that the National Training Board's current functions do not allow it to provide the necessary attention to developing skills trade persons. The administration of the national certification or the promotion of apprenticeship programs. Mr. Speaker, the National Training Board was established as a KRINGO in 1997 under the National Training Board Act and has played a pivotal role in overseeing trades apprenticeship training schemes. Indeed, it has contributed greatly to our national workforce development. However, in recent years, it has become evident that the legislating governing the training board does not adequately reflect the evolving governance and structure needed to function effectively. Mr. Speaker, regrettably, previous efforts made to enhance collaboration between workforce development entities and the business community have not been successful, and the National Training Board continue to operate without the desired clarity. Consequently, it has struggled to be effective in its role to provide advice to the Minister of Economy and Labor on Bermuda's workforce development strategy and to administer national certifications or promote apprenticeship programs. In light of these challenges and the importance of aligning our workforce development system with the needs of our industry, the bill I will be tabling today seeks to create the National Certification and Apprenticeship Board, which will operate alongside a separate non-statutory National Workforce Advisory Board. Mr. Speaker, the ministry recognizes the importance of a board responsible for certifications and training, having clearly defined functions. This clarity of functions will enable the establishment and delivery of apprenticeship education programs, the issuance of national certification credentials, and the governance of skills trades in Bermuda. Mr. Speaker, considering the state of unemployment in Bermuda, the work of the newly established National Certification and Apprenticeship Board is critical to enhancing apprenticeship programs and national certification in order to improve employment opportunities within our workforce. It is imperative that the government work in harmony with workforce stakeholders, and the new approach will be instrumental in achieving this goal. In addition to current functions, the following will be added to the list of responsibilities: producing a national register of tradespersons, both for designated and non-designated trades, draft a comprehensive prior learning assessment and recognition of prior learning policy to formally frame the process for this means of assessment, and update and streamline the national certification process. Mr. Speaker, at this time, I would like to thank all past members of the National Training Board and Occupational Advisory Councils for their hard work, dedication, and support of the Department of Workforce Development. I look forward to working closely with my esteemed colleagues and stakeholders as they assume their new roles on the new board and committees to ensure Bermuda's workforce development strategy remains responsive, dynamic, and aligned with the needs of our community. Thank you, Mr. Speaker.
Thank you, Minister. Members, I should say before I acknowledge the next statement that because the systems are down, as you know, none of the information is accessible in the SharePoint, but once we are, it'll all be on SharePoint for everyone. Papers we're going back to hard copy again. So there are papers in your chair for the statements and the business of the day. But once SharePoint is up, you'll be able to get the information off the SharePoint, okay? The next statement this morning is in the name of the Minister of Health. Minister Wilson?
Thank you. Good morning, Mr. Speaker. Mr. Speaker, I rise today to provide this honorable House and the public with an update on the work undertaken and the progress made to date to strengthen Bermuda's health system. Bermuda's health system needs strengthening to ensure that all residents can access affordable and essential healthcare services that are delivered effectively and efficiently. The results will include experiences and health outcomes and a decreased economic burden overall. Mr. Speaker, the Bermuda Health Strategy 2022 to 2027 supports the core visions of healthy people and healthy communities and sets out 8 strategic principles that are intended to set us on a new path towards the equitable, accessible, and sustainable health system for the island. These 8 principles, Mr. Speaker, are as follows. 1, promoting healthy living and preventative care. 2, focusing on person-centered care. 3, understanding our population's health needs. 4, providing access to healthcare coverage. 5, strengthening our healthcare workforce. 6, harnessing healthcare technology. 7, partnership and collaborative working. And 8, preventing wasteful care and promoting efficiency. Mr. Speaker, achieving a stronger, more sustainable health system requires us to progress all 8 strategic principles, and I'm pleased today to report on the progress made to date. First, Principle 1, promoting healthy living and preventative care. Mr. Speaker, we know that health promotion and disease prevention are essential ingredients in building a more robust health system and a healthier population. Many of the chronic illnesses impacting our community and placing a heavy burden on our healthcare resources are strongly related to lifestyle factors such as poor diet, physical inactivity, and smoking. We understand that more must be done to empower and support people to lead healthy lifestyles, and we will do just that. Mr. Speaker, it is important to note that the emphasis on health promotion includes mental health as well. There is a recognized need to challenge historical stigma and preconceptions about mental health. Good physical and mental health are collectively a part of our efforts to promote wellness and healthier living. For 2023-24, the Department of Health's Health Promotion Unit received additional funding for implementing the HEARTS program and new health promotion and wellness initiatives, as well as facilitation of the mental health first aid training. And this is just the start. Mr. Speaker, the 2nd and 7th strategic principles are focusing on person-centered care and partnerships and collaborative working are encapsulated in work undertaken by the Bermuda Hospitals Board, the Bermuda Cancer and Health Center, and now the Ministry of Health to develop integrated care pathways that map the journey of a patient's and services providers along different healthcare tracks. Integrated care pathways set out in detail the essential care steps for people with specific needs from the viewpoints of the patient and their families and the care provider. The care journey, Mr. Speaker, is mapped from beginning to end. It defines what happens when and who is responsible at any stage along the journey. The BHB has developed care pathways for breast cancer, prostate cancer, and end-of-life care, working with the Bermuda Cancer and Health Center, as well as others. The ministry engaged KPMG to work with patients and care providers to develop integrated care pathways for the first 1,000 days of life, chronic kidney disease, and acute adult mental health. Approximately 1,135 stakeholders were directly engaged within these 3 care pathway initiatives. This included 751 residents who responded to the 3 community surveys and approximately 255 patients, health service providers, and other health stakeholders who participated in workshops and one-on-one interviews. And this is an excellent example of the level of collaboration and diversity of stakeholder voices that we are seeking to include as we continue to work on generating solutions to strengthen Bermuda's health system. Mr. Speaker, the purpose of collaboratively developing these care pathways, and in particular including both patients and service providers in the exercise, is to identify gaps and/or fragmentation in care and seize opportunities to improve coordination of and reduce duplication in services. In this regard, having a person-focused approach is critical to capturing all elements of the care journey. Mr. Speaker, the patient's care journey provides the patient and family viewpoints, while the service map reflects what each clinician does. These two elements of the care journey together inform the solutions for the integrated care pathway result. With this more comprehensive information available, healthcare providers can implement changes in the care journey that improve the experience of the individual receiving the care, most importantly, improve health outcomes. The integrated care pathway for acute adult mental health has been completed, while the final drafts of the first 1,000 days of life and chronic kidney disease are the subject of final reviews. Mr. Speaker, we have also made progress in principle number 3, understanding our population's health needs, and that's another strategic principle, Mr. Speaker. Last year, I reported to this honorable House that the ministry would undertake an assessment of our population's health needs. To better manage health system strengthening and giving the island's financial constraints, we need to understand our priority health needs to properly align our efforts to sustainability, improve, and the health of the people of Bermuda. Mr. Speaker, I'm pleased to inform you that with the support of the Public Health Registrar with the UK Health Security Agency and the UK Overseas Territories team at the Department of Health and Social Care in London, along with resources kindly provided by the Department of Statistics, public health professionals, epidemiologists, health promotion professionals, and representatives from the Bermuda Health Council, Bermuda's first Joint Strategic Needs Assessment, or JSNA, is complete and has served to provide the strategically critical baseline of information. Analyzing the best data currently available through the JSNA sought to understand the health needs of Bermuda by considering Bermuda's population profile and the social determinants of health, our health behavior and risk factors, the causes of ill health and death, the specialized needs of vulnerable groups, including children, the elderly, and people with disabilities, and the current state of our healthcare services. It is a foundational piece of work that brings together the many factors impacting our healthcare, and health system in one document. Mr. Speaker, honorable members will know that it is not just medical care that influences our health. Social and economic conditions, including our housing, work, education, and local community networks, are important factors that define our health. And these are the factors, Mr. Speaker, known as the social determinants of health. By understanding this comprehensiveness needs assessment using the concept of the social determinants of health, which is more holistic approach, the Joint Strategic Needs Assessment is a report that can be used by the whole of government and civil society to develop actions to protect and promote health in various settings, whether in the classroom, the workplace, or local community settings where people live and recreate. Mr. Speaker, the JSNA will be made available and downloaded on www.healthstrategy.bm. Mr. Speaker, some of the JSNA recommendations include the following: developing strong and linked health information at an individual level, developing a model of health and social care focused on care of the elderly, focusing on social determinants of health rather than just health care, developing payment mechanisms for clinicians involved in healthcare quality improvement and health system strengthening, where improvement in outcomes can be demonstrated, improving the quality of domestic incident reporting systems, and incentivizing the provisions of smoking prevention and cessation services. There are 24 recommendations in total, Mr. Speaker, and a number of which are beyond the remit of the Ministry of Health, and several of which are being worked on by different government departments and agencies already. The decision to enlarge the assessment to include the social determinants of health contributed to recommendations that are wide-ranging and are also reflective of the existence and the extensive needs of the population. Mr. Speaker, the ministry intends to undertake another joint strategic needs assessment in 5 years. Mr. Speaker, with respect to strategic principle number 6, harnessing healthcare technology. On this point, honorable members will recall the government's commitment to developing a national digital health strategy. And I can inform this House that the first draft of the National Digital Health Strategy is also largely complete. In undertaking the exercise of developing the National Digital Health Strategy, an interdisciplinary working group of health and technology professionals from the public and private sectors was set up in October of 2022. And their work resulted in the development of 15 strategic recommendations that lay out a holistic approach to implementing a national digital health system in Bermuda. Digital health, Mr. Speaker, is defined as embracing the integration of technology, people, and systems to organize and deliver healthcare services and data efficiently. The strategy outlines a best practice approach to ensuring digital health can become a reality and that members of our community can benefit from the enhanced care that is possible through this level of integration. This would include residents having online access to their health records through patient portals, practitioners being able to better coordinate care with more immediate access to test results and the input of other professionals on the treatment team, and a reduction of duplicate lab tests and scans, thus reducing waste and inefficiency. Ultimately, Mr. Speaker, the National Digital Health Strategy seeks to integrate efficiency and cost effectiveness into the healthcare system while tackling the current burden of health expenses and the fragmented nature of the healthcare delivery in Bermuda. And yes, it is intended to support the delivery of universal health coverage. Mr. Speaker, this is a multi-year effort, and I look forward to sharing the full report in the coming weeks. Mr. Speaker, with the Joint Strategic Needs Assessment and the National Digital Health Strategy completed, the ministry has established Bermuda's baseline for health system metrics. The purpose is to provide a set of metrics that will enhance our understanding of health system outcomes. These metrics will inform decision-making as we seek to improve healthcare delivery at the national level. A core working group of key stakeholders in public health and the private sector reviewed existing health system metrics available for inclusion as a starting point. The process is brought together in one place, health system information from a variety of data sets. Selected health system metrics include health expenditure per capita, out-of-pocket health expenditure, life expectancy at birth, infant mortality rate, number of nurses by population, average length of hospital stay, avoidable mortality, and emergency department visits based on the severity and intensity of patient care episodes. Mr. Speaker, this first set of baseline health system metrics contains the metrics that are available in the short term. A task and finish group will identify and prioritize future key metrics. Moving forward, as the National Digital Health Strategy is implemented and impacts the secure collection of health data, additional health metrics can become available and be collected more efficiently. Presently, the ministry is working to create a public dashboard to display the baseline health system metrics that are already collected. Mr. Speaker, an additional project embarked upon this year is the merger of the government funds. This is linked to strategic principle number 8, preventing wasteful care and promoting efficiency. As stated in the Bermuda Health Strategy 2022-2027, the health need is for the government to realize opportunities to ensure the future sustainability of healthcare in Bermuda, and this includes assessing the sources and uses of all of the government's health funds. The ministry is currently reviewing the options for optimization, recognizing that reforms of overall health system financing is the larger project. Mr. Speaker, as honorable members can see, the Bermuda Health Strategy 2022-2027 is not a document that is sitting on a shelf gathering dust. The strategic principles contained within it guide the work of the ministry, and collectively following through with them puts us on the path to strengthening our health system. The one strategic principle yet to be advanced is principle number 5, strengthening our healthcare workforce, and this will be included in the upcoming projects. While all the strategic principles are important, Mr. Speaker, principle number 4, providing access to healthcare coverage, in other words, universal health coverage, remains a fundamental principle that I would like to turn to now as part of this comprehensive update. As I do so, you will see that the strategic principles, whilst listed separately in the health strategy, do overlap in their contribution to health system improvement. Mr. Speaker, the Ministry of Health has spent the past year completing the setup of the transitional governance structure needed to develop and manage the implementation of universal health coverage. The vision of universal health coverage, or UHC, Mr. Speaker, is to ensure that all Bermuda residents have equitable access to quality care without suffering financial hardship when paying for these services and critical medicines. Mr. Speaker, as previously reported, the UHC governance structure includes the UHC Steering Committee, which is chaired by the Chief Strategy Officer, reporting to me as the Minister of Health. It is important to note that the UHC Steering Committee has been fully engaged and at work for the past 2 years. In addition to the UHC Steering Committee, Mr. Speaker, there are 5 health forums that also comprise the UHC governance structure. And the health forums represent the many stakeholders involved in the health system, including patients, providers, which includes a range of health businesses such as physicians, nurses, labs, physiotherapists, pharmacists, and others, the payers, which are the employers, regulators, and community organizations such as the nonprofits and the unions. The role of the forums is to provide insight, feedback, and recommendations to the UHC Steering Committee from their various areas of expertise and/or experiences. The Ministry of Health's Program Management Office executes UHC projects and supports the forums and the UHC Steering Committee. Mr. Speaker, the first of the forums, which is the Clinical Senate, has been meeting monthly since January. The Clinical Senate is comprised of a multidisciplinary group of over 50 health service providers who provide professional clinical advice and recommendations to the Ministry of Health for its further consideration and decision-making for the Universal Health Coverage Program. For the remainder of the forums, health financing, health insurers, health advocacy, and service providers, a wide range of health system stakeholders have been invited to participate, and meetings will begin next month. I want to take this opportunity to thank the chairs and deputy chairs of the various health forums for their work so far and the work to come. Their experience and contributions will be invaluable for strengthening Bermuda's health system. Mr. Speaker, the setting up of the Program Management Office is moving forward as well. In addition to project managers who previously consulted with the Ministry of Health, 3 new temporary additional posts were approved, 1 for the UHC Program Director and 2 for additional project managers. The Ministry of Health is well aware of the public's desire to know what is next and when will UHC be a reality. As work on the initial projects that I've just shared with you has ended, the UHC Steering Committee, with the support of the Program Management Office, looked ahead to the next steps of the journey to universal health coverage for all residents. Mr. Speaker, the recommendations arising from the first set of projects gave birth to a list of approximately 64 new projects, many of which carry on from these initial projects and initiatives. And the next phase of work is grouped into 8 health initiatives or major projects, and they are as follows, Mr. Speaker: healthcare modeling, National Digital Health Strategy Implementation Planning, National Health System Metrics, National Health System Standards, UHC Core Health Services, the implementation of completed integrated care pathways, and the beginning of the process for new care pathways, health regulation, and healthcare workforce strategy. You will note the inclusion of initiatives such as the National Digital Health Strategy, integrated care pathways, and others previously reported on. Mr. Speaker, the inclusion of such initiatives represents the second phase of work coming out of the initial findings and recommendations of the first phase. Mr. Speaker, healthcare modeling involves understanding Bermuda's current and future healthcare costs, services, and population needs, including future utilization of care services on and off the island. Healthcare modeling also includes developing options for more effective health system financing based on current and projected needs. Phase 2 of the National Digital Health Strategy Initiative will entail setting up an appropriate governance structure and developing an implementation plan to begin to integrate data across the health sector into a centralized system, making patient-level health data more available and enable better reporting across the system. Mr. Speaker, this should ultimately improve the overall quality of care and health outcomes of patients. The National Health System Metrics Project will continue with identifying the metrics needed for the UHC program, as well as the measures most needed or desired by the community. National Health System standards will involve determining the relevant data standards for Bermuda and developing an implementation plan for those health data standards. This is linked, Mr. Speaker, to the need to improve the coding of healthcare services and procedures in health records. The data we can retrieve from health records is only as good as the data that was input. Both his health system metrics and health system standards are part of the larger national digital health strategy. UHC Core Health Services refers to developing the list of core health services that should be part of the UHC Core Benefits Package. An essential part of the assessment of the core health services centers on the learning that has come about from the integrated care pathways. The next phase of work will comprise implementation plans based on the recommendations from the completed pathways and undertaking new care pathways. Health regulations are identified as a project, as they will be the subject of ongoing updates on an as-needed basis. And finally, Mr. Speaker, developing a healthcare workforce strategy is extremely important, particularly with the intense competition for healthcare professionals and the lack of healthcare givers across the health system. Our population is aging, which brings with it particular care needs that must be taken into account. Overall, having a strong healthcare workforce is essential for delivering on our commitment to strengthening our health system. Mr. Speaker, the Ministry and UHC Steering Committee are of the view that if sufficient resources are in place, resources that are both internal and external to the Ministry, then we can plan and aim for the following milestones. April 2024, define the core healthcare services to be included in the benefits package for all residents. April 2024, understand the demand and cost to deliver the core care services and develop payment model options for the core care services, as well as consider wider health system financing. July 2024, undertake financial analysis to baseline and then model options for the core care benefits package. Also evaluate the economic impact of the options. September 2024, recommend to Cabinet the most suitable and sustainable options enabling delivery of the core care benefits package, ensuring cost meets resources, both system and individual. And April 2025, adopt a phased approach to implementing the core care benefits package, starting with the basic core benefits for all. Mr. Speaker, honorable members will recall the initial roadmap to achieve universal health coverage proposed that Bermuda adopt an approach comprising a thin level of coverage for everyone. And from there, additional healthcare services would be built out and added unto the core care benefits package is complete. Mr. Speaker, this is the approach the ministry continues to advocate for, recognizing that over time, benefits will adjust in accordance with what our population health needs. Mr. Speaker, the above list of milestones represents a very ambitious timetable, and it will be reviewed and reprioritized as necessary. However, this government continues with its commitment to universal health coverage to ensure that all Bermuda residents have access to essential quality health services when they need them without suffering financial hardship. We look forward to working collaboratively and constructively with the UHC Steering Committee, the health forums, and the many health system stakeholders to achieve the goal of universal health coverage and improved health outcomes for our residents within a strong, sustainable health system. Mr. Speaker, the next statement, Mr. Speaker, entitled Celebrating Wellness Family Games. Mr. Speaker, again, I rise to highlight an important initiative organized by the Ministry of Health in collaboration with Extreme Sports Limited to promote healthy living. Mr. Speaker, the Celebrating Wellness Family Fun Night will be held on Wednesday, the 27th of September from 5 to 8 p.m. The Department of Health has partnered with Extreme Sports Limited to host games for families to compete in friendly physical competition. Teams will compete in a series of stations set up within the show ring at the Botanical
Excuse me
Gardens.
a minute, Minister. Have you gone into the next statement?
Yes, sir.
Good.
Yes, Mr. Speaker.
I missed that. Go ahead.
Teams will compete in a series of stations set up within the show ring at the Botanical Gardens. Celebrating Wellness, Mr. Speaker, is recognized annually by the Health Promotion and Wellness Office of the Department of Health. Celebrating Wellness is an opportunity to encourage the public to live healthy by highlighting ways to live well. Mr. Speaker, as I just referred, the Bermuda Health Strategy 2022-2027 outlines 8 strategic principles for improving healthcare in Bermuda, from promoting healthy living to harnessing healthcare technology and preventing wasteful care, promoting efficiency. Principle 1 is promoting healthy living and preventative care, and Principle 7 is partnership and collaborative working. And this event is an example of both principles in action. Mrs. Speaker, in the spirit of promoting a healthier and happier community, this year's Celebrating Wellness event focuses on the family. Recognizing the impact that family dynamics have on individual well-being, the event aims to provide resources and activities that empower families to prioritize their health and bond together. Celebrating Wellness is dedicated to strengthening the foundation of wellness within every household. The family games will start at 5:30 p.m. again on Wednesday, the 27th of September in the main show ring of the Botanical Gardens. Each team must have 5 family members, with 2 of them being between the ages of 5 and 17. And Mr. Speaker, team members can extend to aunts, cousins, godparents, etc. Competing families will visit the various stations by Extreme Sports throughout the show ring. Families will be awarded points as they compete each station as a team. At the end of the evening, the accumulated points will be tallied. There will be a prize presentation at the end of the evening at approximately 7:45 p.m. Prizes will be awarded to the best dressed team, the most creative team name, the top 3 teams with the most points. And this is an exciting opportunity, Mr. Speaker, for families to improve their health while having fun at the same time. There are a couple days left to sign up, and I encourage my honorable colleagues and the public to participate. Mr. Speaker, initiatives like this promote the importance of active living. Physical activity and healthy eating have long been proven to reduce the risk of chronic non-communicable diseases such as diabetes, heart disease, and cancer. Consistent physical activity like walking helps also improve quality of life, mental health, and healthy aging. To participate in the family games, please complete the registration form at http://forms.gov.bm/celebrating wellness. First 10 teams to register will receive a gift, and members of the public can attend to visit the booths and watch the games. As this is a physical activity, Mr. Speaker, individuals are recommended to check with their healthcare provider to ensure that they are fit to compete, as the event organizers are not liable for any loss, damage, or injury. Mr. Speaker, if you have any questions or anyone, please contact the Health Promotion and Wellness Office by emailing healthpromotion@gov.bm or alternatively calling 278-4900. Thank you, Mr. Speaker. Yes, thank you, Mr. Speaker. Mr. Speaker, I rise today to announce the 2023 Dr. Barbara Ball Public Health Scholarship awardees to this honorable House and members of the public. Mr. Speaker, this scholarship is offered in honor of Dr. Barbara Bertha Ball, who was the first born Bermudian woman to practice medicine in Bermuda and a tireless champion for people's rights. After a brief stint in the UK, she returned to Bermuda in 1954 to dedicate herself to the welfare of the underprivileged. Mr. Speaker, this scholarship covers a range of healthcare fields of study that directly benefit public health and are a priority to public health needs in Bermuda. And it is another example, Mr. Speaker, of this government's commitment to strengthening our healthcare workforce and one of the 8 strategic principles of the Bermuda Health Strategy 2022-2027. In this year's budget, $100,000 of funding was provided for the Dr. Barbara Ball Public Health Scholarship, which is awarded to Bermudian students demonstrating academic excellence whilst pursuing careers or professional development in public health. Bermuda has a shortage of healthcare professionals, especially in critical areas that have a significant impact on public health. This initiative reflects the Ministry of Health's commitment to encouraging and supporting Bermuda's young people to join the healthcare workforce and perfectly aligns with what I believe Dr. Barbara Ball would have envisioned. Mr. Speaker, this year, 10 successful first-time awardees received $10,000 each, and they are as follows, Mr. Speaker. Miss Alicia Bailey Lewis, who is studying medicine at St. George's University in Grenada. Miss Jordan Bascom, who's also studying medicine at the American University of Antigua. Mr. Joshua Correa, who is studying medicine also at the St. George's University, Grenada. Ms. Daiwan DeRosa, who is studying public health at the University of Toronto. Miss Storm Gibbons, who is studying medicine at St. George's University, Grenada. Miss Romel James, who is studying nursing at Glasgow Caledonian University in Scotland. Miss Roche James, who is studying nursing at the University of Salford in the UK. Miss Hurley Purvey, who is studying health sciences at Western University in Canada. Miss Veronica Swan de Graft, who is studying medicine at the St. George's University in Grenada. And Miss Tiana Thomas Clark, who is studying nursing at the Virginia Commonwealth University in the United States. Mr. Speaker, the Scholarship Selection Committee was privileged to receive 71 applications this year, including many of high standard. Candidates were assessed on academic achievement, financial need, public health need, and the quality of their applications. 23 shortlisted candidates were interviewed, and after a very difficult selection process, 10 candidates were awarded $10,000 each. Mr. Speaker, I wish to extend my congratulations to the 2023 Dr. Barbara Ball Public Health Scholarship awardees, and I wish them a successful academic year. Thank you, Mr. Speaker.
Thank you, Minister. Members, the next statement this morning is in the name of the Minister of Education. Minister?
Good morning, Mr. Speaker. Good morning, colleagues. Good morning, Bermuda. Mr. Speaker, I rise today to provide this House and the listening public with an update on the topic of school readiness for the school year that has just commenced. I want to take this time to remind honorable colleagues of the critical importance of education and the reform agenda to the overall success of our country. The desire to consistently make comments that are not factual or spoken out of context to achieve political ends is neither helpful nor warranted when it comes to public education reform. As you know, Mr. Speaker, despite comments purposely disseminated to create discord by opposition members and others, all 34 public schools opened for students on Monday, September 11th. Lost in the public discourse on that day was the fact that we opened 2 parish primary schools, have students commencing on the second year of signature learning programs, and education reform is moving along. This is not to say that there has not been challenges. Mr. Speaker, there were challenges in the face of an increased workload over the summer break, resource constraints, and some lapses in coordination between the various partners that worked on readying the facilities for our staff and students. Mr. Speaker, I thank all of the educators, education officers, ERU staff, support staff, maintenance crew, and our colleagues from Public Works for their dedication and hard work to prepare schools for our students. I also acknowledge the teachers' union's recent concerns and importance of addressing them. Mr. Speaker, today, I would like to provide some context so we can have a bit more objective information and perspective on the school readiness issues. Mr. Speaker, every year, the Department of Education's facility section with contractors from the private sector and Public Works. They provide routine maintenance for all of our schools and other physical facilities. In addition, the IT department undertakes a number of maintenance and upgrade projects. At the same time, our building custodians are tasked with ensuring the cleanliness of the facilities before they are occupied at the start of the academic year. These maintenances occur during the summer months, which I remind colleagues are July and most of August. Mr. Speaker, this past summer, our summer works projects included approximately 1,250 tasks or projects in our schools and facilities, and special works for the 2 parish primary schools as requested by the school transformation teams. In addition, work had to be done on the decommissioned sites of Clearwater Middle School and Heron Bay Primary. Mr. Speaker, our facility section consists of 1 facilities manager, a head of custodians, and an administrative assistant. We are grateful for Public Works, and we are grateful to Public Works specifics of their concerns so they can be appropriately addressed and dealt with. Mr. Speaker, the department and the BUT had a difference of opinion concerning Purvis Primary regarding whether classrooms were ready to receive students at the start of term. These concerns were discussed and in the spirit of collaboration resulted in an agreement to give teachers additional time to customize their classrooms. Teachers at Francis Patton took additional time. Teachers at Francis Patton took a different approach to similar concerns caused by a delay in the works timeline. It should be noted that the situation at Purvis Primary, where summer works delays impacted teacher preparation schedules, was exacerbated by a power supply outage initiated by Belco, which resulted in Purvis being without power during one of the 4 days used for final prep before school was to open on September 11th. Mr. Speaker, due to the agreement between the BUT and the DOE, Purvis Primary students engaged in experiential learning during the first week of the new school year, which can only be described as bizarre. The opposition has already derided the concept of experiential learning as something inferior. Mr. Speaker, experiential learning is connected with the Bermuda History and Social Studies curriculum. As we transform education, we are moving towards more experiential and personalized learning, where we meet students where they are and build on that. Yet, the Shadow Minister of Education has indicated that he believes that experiential learning is somehow inferior. I can only conclude that the many times I've reached out to the opposition to engage in education reform updates and have not received a response as a reason why such thoughts could be held. Yet again, another sad indictment of the opposition's true understanding of education reform. Mr. Speaker, in short, while not initially planning for the solution that was agreed to by the BUT prior to Purvis Primary opening on September 11th, as a reminder, this allowed teachers time to personalize their classrooms. The learning experiences our students engaged in during the first week of school were aligned with our approach to improving education. Mr. Speaker, concerns have been expressed about safety matters. Our children are entitled to safe environments conducive of learning, and in response to safety and health concerns expressed by Purvis Primary teachers, Mr. Speaker, the Department of Environmental Health conducted a safety inspection of the school on September 8th. That inspection took place as work was continuing in the school, and any matters identified were addressed on September 10th, 9th, and 10th. Mr. Speaker, as we embark on reform for education, for public education, the department has been committed to continuous improvement. At the start of the school year, 35 school and site leaders, including the Child Development Program Facility, were asked to evaluate the state of readiness of their sites for the new school year as of September 11th. This system-wide survey yielded the following results. 27 of the 34 leaders indicated that they were either neutral, satisfied, or very satisfied overall with the work done at their sites over the summer. 5 in the neutral category, neither satisfied or dissatisfied. 14 were satisfied, and another 7 reported as being very satisfied with the summer works done at their sites. 5 of the 34 school leaders were dissatisfied with the work done over the summer, and 3 indicated that no work was done at their site at all. Aided schools such as Whitney and St. George's Prep do their own maintenance. Drilling down to classrooms, 29 of the school leaders rated their classroom site readiness in terms of classrooms as either excellent, more than satisfactory, or satisfactory. Another 5 indicated that more work was needed to be done as of September 11th. The average rating across the system on a 5-point scale was 3.5. In terms of non-classroom space, 29 of the 34 school leaders rated their school site readiness in terms of non-classroom space as either excellent, more than satisfactory, or satisfactory. Here again, another 5 indicated that there was more work to be done as of September 11th. The average rating across the schools on a 5-point scale was 3.5 for this category. Mr. Speaker, those are the headlines regarding school readiness at the start of the school year. Work on resolving some outstanding issues was ongoing through the first week, although some delays have been encountered due to weather. Some of the issues involved air quality, provision of air conditioners, playgrounds, and technology. The department is analyzing the data and in collaboration with school leaders, facilities, and our partners at Public Works, will address processes and coordinated improvements from now on, as well as those issues that have been identified as outstanding for some time. In the future, the evaluation survey will take place a few days before teachers are due in school to prepare their classrooms. Mr. Speaker, in addition to the maintenance work, the technology infrastructure is also serviced and upgraded annually. As some of the issues identified as outstanding were IT related, I would like to provide a brief overview of the type of work done by the IT department and some challenges and issues. In brief, Mr. Speaker, the IT section is responsible for maintaining and operating and upgrading the public school system's IT structure, including servicing and upgrading laptops and other devices issued to staff and students. Daily, IT supports 1,804 student devices and 3,364 staff devices, which include laptops, desktops, and phones. It handles security and issues with user accounts, including PowerSchool accounts. Discharging these responsibilities is a team of 10 full-time staff. Mr. Speaker, the on-site, local to every school IT section works tasks cannot start until school custodians have completed their work, which in turn is impacted by the maintenance, repair, and construction schedules. Compounding the challenge for IT is that all department-issued laptops needing major updating to sync with updated and new IT security tools and operating system patching. All core and many other teachers and officers of the department have been issued with laptops. Mr. Speaker, this summer, all laptops required significant updates, and IT must have possession of them to do the revisions and updating. However, I was made aware that, I've made to understand that unfortunately, most of the primary school department education laptops had not been left in the school offices despite requests to do so. This then resulted in these required updates to be done during the first week of school, a process that would have left teachers without devices for periods of time. The only school to comply entirely with IT's request was Prospect Primary. Similar requests to enroll in safe and security protocols such as Password Portal met with less than 50% compliance by task, and this has had an adverse effect on device connectivity. Finally, Mr. Speaker, construction delays, lightning strikes at some primary schools have delayed all low voltage data cabling tasks, delaying updating some locations with working connections. BPS schools impacted most were St. George's Prep, Francis Patton, Harrington Sound, Paget Primary, and Purvis Primary. Mr. Speaker, despite our best efforts, in addition to the aforementioned IT works, there are still some outstanding works underway. As a result of a wood shortage this summer, proposed purpose-built cabinets and storage at Francis Patton Primary and Purvis are still being worked on. Additionally, there are other minor works still outstanding, but these works are underway and look to be resolved in due course. Mr. Speaker, resolving all of these issues would involve better communication, collaboration, and coordination, whether it's with our partners, staff, families, and the Bermuda Union of Teachers. These are issues that the Department of Education will work collaboratively with stakeholders to ensure the same issues do not arise next year. Mr. Speaker, the ministry will monitor and assist the Department of Education as much as possible as they look to put better processes and procedures in place. We are committed to supporting these efforts while staying the course of education reform. As we will shortly embark on onboarding school transformation teams for the creation of parish primary schools for Elliott and Harrington Sound, as well as the third signature school at Sands Secondary Middle School, I invite the general public to join us as going all in for our students. Feel free to submit your names and become part of the team that will continue to design and drive the education agenda forward. Thank you, Mr. Speaker.
Thank you. Thank you, Minister. Members, the next statement is in the name of the Minister of Social Development and Seniors, Minister Hayward, Minister Furbitt, rather. Would you like to present your statement?
Good morning, Mr. Speaker.
Good morning.
And thank you. Mr. Speaker, it is with great pleasure that I rise this morning to share with my honorable colleagues the beginnings of a sustainable plan to end homelessness in Bermuda. Mr. Speaker, homelessness is a growing problem in Bermuda. The 2010 Census of Population and Housing used the term non-sheltered population to define those persons who had no fixed abode and who did not stay in adult shelters. Such persons had no habitable dwelling to call home and usually slept outdoors. At that time, the number of non-sheltered persons counted was only 82, but this increased to 138 persons during the 2016 census. However, it is globally recognized that homelessness is far broader. In fact, Mr. Speaker, there is no common international definition for homelessness, but it is generally defined to include persons who lack stable and appropriate housing to the extent they are living on the street, living in vehicles, living on the couches of family and or friends, moving between temporary shelters with just a room, house sharing, or housing with friends, sharing transitional living and emergency shelters, and living or squatting in abandoned, unoccupied properties that do not meet the minimum standard or provide no security. Current research by the Bermuda Charity Home indicates the homeless population within this definition reached 650 persons by December of 2022. Mr. Speaker, rough sleeping is the most visible form of homelessness, which can be voluntary or involuntary. A person can be voluntarily homeless for a number of reasons. We know there is substance abuse, mental health issues, domestic abuse, family breakdown, poverty, unhealthy relationships, or just plain apathy that could be the impetus for voluntary homelessness. Mr. Speaker, a person can be involuntarily homeless due to the end of their current housing lease term and not able to afford other accommodations due to insufficient income or unemployment, or sufficient affordable housing options. Mr. Speaker, homelessness stems from many types of situations. However, the United Nations International Covenant on Economic, Social, and Cultural Rights stipulates, and I quote, "the right of everyone to an adequate standard of living for himself and his family, including adequate food, clothing, and housing." Homelessness touches on several of the United Nations 2030 Sustainable Development Goals. Goal number 1, no poverty. Goal 8, decent work. Goal 10, reduce inequalities. And Goal 11, sustainable cities and communities. Mr. Speaker, let me share a brief historical summary of several attempts that have been undertaken to address the homeless population in Bermuda during the past years. In 2000, the Ministry of Health and Family Services commenced a study of homelessness with the goal of obtaining key information to plan appropriate services for the homeless in Bermuda's community. This study was later paused due to the conduct of the 2000 Census of Population and Housing, which will provide information on the homeless. In 2007, former Ministry of Social Rehabilitation activated the Committee on Homelessness, which included representatives from many of the major service providers on island. The committee was charged with exploring the needs of the homeless and recommending solutions. Also, Mr. Speaker, in 2015, the Department of National Drug Control produced a report from their survey on substance use among the homeless in Bermuda. Later in 2018, a transitional housing think tank was hosted by the Women's Resource Center and Habitat for Humanity, of which 18 charities and government agencies participated. Then in 2018, the then Minister of Social Development and Sports announced the redevelopment of the former Bishop Spencer facility for use as a new emergency housing center. This initiative instead shifted to upgrading the facility at the Salvation Army on North Street. Despite these past studies and initiatives, there has been no sustainable strategy or plan designed and implemented to end homelessness in Bermuda. Mr. Speaker, the government alone cannot end homelessness in Bermuda. A long-term strategy and highly coordinated plan will be needed that involves the many service providers and stakeholders with a demonstrated commitment to ending homelessness. In this regard, the Ministry of Social Development and Seniors, the Executive Director of the charitable organization HOME, and the community and business stakeholders have been working collaboratively during the past year to develop a plan to end homelessness in Bermuda. Therefore, Mr. Speaker, in recognizing this, the charitable organization HOME, which opened its doors in October of 2021, with a vision to end homelessness in Bermuda, is collaboratively using a whole systems approach to provide services and chart a course for the homeless while tracking their progress to systematically end homelessness. This approach also facilitates the collection of data and information about the homeless for informed decision-making. A steering committee established by HOME included community partners STAR, Lighthouse, Teen Haven, Transformational Living Center, Salvation Army, Dignity House, Solstice, and the Bermuda Housing Corporation. Representatives collaboratively dedicated many months to developing a work plan detailing a case for change and recommendations to end homelessness. Mr. Speaker, subsequently, I, along with the Executive Director of Home, have engaged in monthly meetings for discussion and planning around a strategy. And in May this year, we established a homelessness advisory panel comprising of public, private, and nonprofit representatives. The advisory panel, chaired by the Executive Director and myself, have been meeting weekly since the month of June to review the recommended actions put forth by the steering committee, provide input, and strengthen the plan where needed. Mr. Speaker, let me take the opportunity now to share who the members of the advisory panel are. Ms. Denise Carey, Executive Director of Home, the Honorable Mr. Justice Juan Wolf, JP, Supreme Court of Bermuda, Mr. John Barrett, Bermuda Housing Trust, Mr. Dwayne Kane, CEO, Corporation of Hamilton, Ms. Sheila Cooper, Habitat for Humanity, Ms. Sarah Clifford, Human Rights Commission, Mr. Aaron Critchlow, Bermuda is Love, Ms. Pandora Glassford, Permanent Secretary, Ministry of Tourism and the Cabinet Office, Mr. Andrew Diaz, West End and Bermuda Land Development Corporations, Mr. Kirk Otterbridge, Acting Permanent Secretary, Ministry of Public Works, Mr. Paul Martin, Bermuda Housing Corporation, Ms. Laurie Shields, Center Against Abuse, Senator Lindsay Simmons, JP, Foster Care Association, Ms. Keisha Tuckett, our Health Insurance Department, and Mr. Ward, Salvation Army. Mr. Speaker, it has indeed been fruitful meetings weekly with the panel members who have given invaluable input and feedback to progress the work plan for implementation. The recommended actions for ending homelessness are highlighted accordingly. A rapid end to rough sleeping and other forms of high-risk homelessness, a systematic approach to homelessness data and intervention monitoring, insufficient accessible social and affordable housing and welfare entitlements, citizen-centric coordinated service delivery, public policy reform and statutory rights and protection changes, public understanding and engagement, other holistic and system-wide reforms. The review of the work plan is near completion, and the action items in the plan will ultimately guide the progression of work to end homelessness in Bermuda. We look forward to sharing the work plan publicly and the collaborative work ahead. Mr. Speaker, I also want to say that World Homeless Day will be observed internationally on October 10th of 2023. The ministry will recognize this day to draw attention to the needs of people who experience homelessness in Bermuda and provide opportunities for our community to get involved in responding to homelessness. A World Homeless Day proclamation along with activities are being planned in Bermuda. The advisory panel is currently solidifying a plan to recognize this day in Bermuda on October 10th. It will involve the active participation of every person. World Homeless Day is a date everyone can mark in their calendar each year and become involved in helping to eradicate homelessness in our island community. Mr. Speaker, lastly, let me share the leading up to World Homelessness Day on October 10th. The advisory panel approved the undertaking of a community survey on homelessness in Bermuda. Gathering data is critically important for informed and sound decision-making. The homelessness work plan was developed with insights gathered from over 400 men and women experiencing homelessness or at the risk of becoming homeless in Bermuda, and consultation with over 300 stakeholders connected to serving people experiencing homelessness, which included policy experts, researchers, service providers, third sector organizations, and donors. We now want to hear from the general public. The community survey on homelessness will take roughly 30 minutes to complete and will be posted on government's Bermuda Citizens Forum, forum.gov.bm from October 3rd to October 31st. For persons to complete, your participation in the survey is important to feed into the overall plan for ending homelessness. Notices will be sent out to advise the general public when the surveys will commence. Mr. Speaker, in closing, I extend thanks to the Homelessness Steering Committee and the Homelessness Advisory Panel members for the commitment and appreciate the sacrifice of time that they have extended in meetings to lend continued support to progressing this initiative. Also, I am deeply indebted to the Executive Director of whom is Denise Carey, who quietly wields unwavering steadfastness and passion in leading programs and projects to end homelessness in Bermuda. Thank you, Mr. Speaker.
Thank you, Minister. Members, that brings us to a close of the statements for this morning. We'll now move on. Reports of committees, there are none. The next item is question period. And this morning's questions, there aren't any written questions, so the questions will come from the statements that were delivered this morning. And members have expressed an interest in putting questions to the ministers. So we'll start that now. And the first question this morning is for Minister Hayward in reference to your first statement. And the opposition leader would like to put a question to you.
Thank you, Mr. Speaker, and good morning, and good
Morning.
morning, or good afternoon, sorry, to my honorable colleagues and listening public. I have some questions as it relates to the employment protection of employee tips and other gratuities statement. Would the honorable minister please explain just how widespread was the practice of employers taking from the tips of employees? Thanks.
Minister?
Mr. Speaker, I thank the honourable member for the question. First and foremost, what we would do is garner the complaints that come into the Department of Labor. As you can appreciate that the large portion of workers that are impacted would not necessarily make complaints based off of their employment status within the country. We found that work permit holders are less inclined to speak up on the occurrence when abuse is taking place. Additionally, we find that when individuals entered the workplace, they wasn't aware of the policy as pertains to tips and gratuities, and they found out on the floor of the workplace how it is actually administered. So in order to determine how widespread it was, we don't have an accurate figure. What we do know that this is a extremely positive step in the right direction for those employees that work in the industry.
Opposition leader, but before you put your question, I should acknowledge that you are the opposition leader now because it's a new title that you didn't have when we were last in this chambers. So, opposition leader, it's a supplementary or new question?
New question, please, Mr. Speaker. Would the honorable member, would the honorable minister please inform this honorable house in his research as well as consultation with the Labor Advisory Council if any violations of law were detected?
Minister?
Mr. Speaker, there was no governance over how tips and gratuities are administered in the workplace. In organized environments, that is where there are unionized employees, collective bargaining agreements are in place, which speaks to the administration and distribution of tips, gratuities, and service charges. Outside of unionized environments, it's similar to the Wild Wild West, where there is no effective policy and administration in place. I wouldn't say that there is contravention of the law because we didn't have protection in law. What we are seeking to do with this amendment is put the protections of law, and anybody who does not follow the law thereafter will be in contravention of a law.
Second supplementary or third question?
Third question, please, Mr.
Okay.
Speaker. Would the honorable minister please clarify where these changes in law will be explained? As it stands right now, there is a guide to work in Bermuda and a code, and what we're looking for is where will employers be able to look up what they need to put into the relevant policies. Thank you, Mr. Speaker.
Minister?
The first step for any employer would be to look at the amended Employment Act. These are amendments to the Employment Act, and so that will be the first set of direction. Secondly, to this, like we've done with other areas where we've introduced new policy, the ministry will be putting out guidance notes as it pertains to various sections of the amendments within the Act.
Okay, supplementary?
Supplementary, thank you,
Yes.
Mr. Speaker. When would we anticipate, or is there any kind of anticipated date for updated and amended guidance notes?
Understood.
The guidance notes will come out prior to the commencement date in the legislation.
Supplementary?
None, thank you, Mr. Speaker.
Thank you, sir. We now move on. Minister, the opposition whip would like to put questions to you.
Thank you, Mr. Speaker. And somewhat on a similar line to what was already asked, you mentioned on page 3, it has been an ongoing concern regarding instances reported. And of those instances reported, is this been prevalent, for instance, in hotels or restaurants, or has this been a prevalence across the board?
Mr. Speaker, I'll say generally there's lack of clarity across the board by there being no governing policy. The majority of incidents that do occur, which are reported, are from the restaurant industry.
Supplementary or new question?
Supplementary,
Okay.
yes. The minister somewhat answered this question, but I guess I was looking for a little more detail. So as of up until today, until we get legislation in place, there really hasn't been a recourse to this, or do you have any instances where it was corrected?
Minister?
At this point, there is nothing to correct because there is no law in place which governs it. You have workplaces which retain 100% of gratuities from workers and pay workers a flat wage. That does take place in some workplaces, and it is not against the law at this current time. Moving forward, that workplace would have to amend its policy to be in alignment with the law so that the employer does not retain the gratuities and service charges received.
Supplementary?
Yes,
Okay.
second question.
Second question, okay.
Yeah. And with this legislation coming up, has the industry been made fully aware of what's to come?
Minister?
There are representatives on the LAC that represent employer groups, and so they have been made aware of the changes that will be taking place, as well as the representatives of the employees.
Supplementary? No? Okay, fine. Minister, that's the end of the questions for you for that statement this morning. However, your second statement also has questions. The opposition leader, would you like to put your question for the second statement?
Yes, thank you, Mr. Speaker. Would the honorable minister please clarify to this honorable House whether the amendments to the National Training Board Act are adding a board or changing a pre-existing board or removing them? If you could speak to that in summation. Thank you.
Minister?
Mr. Speaker, the amendments change the name of the National Training Board to a National Certification and Apprenticeship Board, which will focus on skills, trades, certification, and apprenticeships. It also reduces, takes away some functions of the old National Training Board and adds new functions to the new National Certification and Apprenticeship Board.
Thank you. Supplementary?
Yes, thank you,
Okay.
Mr. Speaker. It's a second question.
Second question. Okay.
Would the honorable minister please explain in his statement, he spoke to evolving governance and structure. And for that reason, the pre-existing National Training Board has to be amended. Could he speak to what is the evolving governance and structure, which it currently does not have?
Minister?
The way the National Training Board Act was originally designed was that the National Training Board was a Quingo, which means that the board governed the operations of the Quingo. When the National Training Board merged with a government department to create the Department of Workforce Development, the act was never amended so that the functions of the National Training Board, where they had the strategic governance of the National Training Center, were removed. Once it merged into a government department, that means that the control comes under now the permanent secretary and the minister responsible in terms of providing strategic direction. That meant that the act was not in alignment with what was actually in practice. And so what we're trying to do is clean up that as well. And so when we talk about evolving governments, it means shifting from the model that was set out, a Klingo model that was set out, to the traditional government administration hierarchy.
Thank you. Supplementary or new question? New question?
New question,
Okay.
please. Thank you, Mr. Speaker. And would the Honorable Minister please clarify for the Honorable House whether the previous board members were dismissed or were some retained? And because he spoke to thanking board members and then welcoming, I believe, new board members. Could you explain how that membership changed?
Minister?
Mr. Speaker, in anticipation for the changes to the law, in this fiscal calendar year, we did not appoint new members to the National Training Board. And so we currently do not have a constituted National Training Board.
Supplementary or?
None. Thank you, Mr. Speaker.
Thank you. Minister, that's a close of questions for your statement. Thank you. The next statement that has questions this morning is the name of the Minister of Health. Minister of Health, the opposition whip would like to put a question to you regarding your statement on the Bermuda health system.
Yes, thank you, Mr. Speaker. On page 5, I acknowledge that, and this is a great initiative, I must say, after reading the statement, that there were many stakeholders involved. So on page 5 and on page 15, with the UHC steering committee, there are several interest groups laid out. I was just curious as to whether or not with this process, so it's a lot of information being gathered, whether or not the health insurance companies are also involved in this process, or is there no need for that?
Minister?
Thank you. Thank you, Mr. Speaker, and I thank the honorable member for his question. Mr. Speaker, with respect to the process as it relates to the working groups that are helping to form and strategize with respect to all the stakeholders that are involved, there is one of the forms is the health insurance forum. So just like we have a patient's forum, we also have a health insurance forum.
Okay. Supplementary?
No, second question.
Second question? Go right ahead.
Yes, second question. On top of page 13, the Honorable Minister speaks of a collaborative effort, but also speaks to creating this public dashboard to display baseline health. How is that going? Is that like on a web page, going to be on a web page, or how will this public dashboard be managed, and what is it exactly?
Minister?
Thank you, Mr. Speaker. Mr. Speaker, a public dashboard will operate almost akin to the one that we had when we had COVID. So there'll be information that will be uploaded on a regular basis, such as statistics as it relates to mortality, et cetera, et cetera. Some of the information that we've spoken about what will be part of the healthcare metrics, and that will be made publicly accessible so that members of the public can keep well informed.
Okay. Supplementary? Further question? Thank you. Minister, you also have MP Pearman who would like to put a question. MP Pearman?
Thank you, and good afternoon, Mr. Speaker.
Good afternoon.
I thank the Honorable and Learned Minister for her extensive statement on government's progress on Bermuda's health system. And it's nice to hear about progress being made, particularly in the area of universal health care, where obviously the opposition supports universal health care. My question for the Honorable and Learned Minister is in relation to page 17 of her statement. Right at the top of page 17 of her statement, the Honorable and Learned Minister says this, and I quote, with your leave, Mr. Speaker, "The Ministry of Health is well
Go
aware
ahead.
of the public's desire to know what's next and when will UHC, which is universal health care, be a reality." Minister, my question for you is actually a different question, and that is, what does that reality look like? What does universal health care look like for you? Thank you.
Minister?
Thank you, Mr. Speaker. Mr. Speaker, as I indicated in the beginning of the statement, the government remains committed to ensuring that our population health is strengthened. And insofar as strengthening it, it will ensure that all residents can have access to affordable and essential healthcare services delivered effectively and efficiently. And Mr. Speaker, when you look at the Bermuda Health Strategy 2022-2027. It outlines 8 strategic principles, and all of those are actually overlapped, and they're all connected together. It's almost like making a cake. If you don't have the flour, you're not going to have a cake. So all of these 8 strategic principles all work hand in hand as part of the health system strengthening. And one of those aspects of the 8 is, of course, universal health coverage. The government is still committed to rolling that out. You would have heard me speak about the steps that have been made heretofore as it relates to the establishment of a governance structure so that they can see and oversee the whole operation of that. We have received temporary additional posts that I've spoken about here to help to operationalize that governance structure. And then also, Mr. Speaker, if I can invite honorable members to page, it has the timelines that are anticipated, Mr. Speaker. I think it's at page 20. Sorry, thank you, honorable learned member. On page 21, again, with respect to the UHC steering committee that I spoke about, insofar as they are the governance structure, that everything feeds up to them, subject to what is outlined in 2021, that's what it will look like. April 2024, we will start to define the core healthcare services. And I say the word core because for one person, something may be essential, but not to another individual. We're talking about the core things, the things that people need to ensure that they have a healthy longevity of life. And then by April 2024, we're looking at understanding what the demands are with respect to the cost delivery of those. By July 2024, we're looking at undertaking the financial analysis and the baseline of what this core package would look like. And September 2024, recommending to cabinet what the suitable core package will be, with a 2025 rollout as it relates to the core package, starting with what those core benefits are. So that's the anticipated timeline. You can appreciate, Mr. Speaker, there's a lot of work that's been undertaken heretofore. I'd like to thank all of the various stakeholders that have participated in this: insurance companies, patient advocates, medical practitioners, et cetera. It's been a lot of work. We did have a blip called COVID, but we've picked up the ball and we're continuing to run, and we're satisfied with the progress thus far. Out of the 8 strategic principles, we're at 5.5 ticked yes. Thank you.
Thank you. Supplementary or new question?
Supplementary, please,
Go right
Mr.
ahead.
Speaker. You'll recall my question was, what does a UHC look like for this government? Honorable Learned Minister, page 15 of your statement, you say, and again, I quote with your leave, Mr. Speaker, it is important to note that the UHC, that's Universal Health Coverage Steering Committee, the UHC Steering Committee, has been fully engaged at work for the past 2 years. So in view of that engagement and 2 years of work, I want to return to this question as a supplementary, what it looks like. Is this going to be provided, is UHC, Universal Health Coverage, going to be provided by the private sector, or is this a public sector provision that's being envisaged by your 2 years of work?
Minister?
Thank you, Mr. Speaker. Mr. Speaker, as has been indicated in this honorable House previously, the UHC is looking at twofold. There's the core benefits package that will be operationalized insofar as who will be holding that package, what structure will be holding that, whether it will be an insurance company, a Quango, a conglomerate. That work has not been, that work is still ongoing, and a determination has not been made. We've also maintained in this honorable place that there will always be a need for supplemental health insurance from the private insurers. This core package will be something that will be an essential package of core benefits, starting for all individuals that will be required to be in every person's insurance policy, and then the supplemental benefits, which will be offered by the private insurance companies, will still be required.
Thank you. Supplementary or new question?
Second supplementary.
Go right ahead.
Yes, thank you. And thank you for that answer, Honorable and Learned Minister. Just again, trying to get at what it looks like and who's going to be providing it. You answered about the core care benefits package, and I'll come back to that in a second. But you also answered there on terms of the provider, the payor, the party there that's delivering the services. You said insurance company, Quango, or conglomerate. And I understood you to say that that hasn't been decided. So we don't know whether or not this is going to be universal health care provided by private sector or public sector as yet. That's not been a decision that's been taken. Is that right?
Minister?
That's correct. That work is ongoing, and we have, again, the health forums, the 5 health forums that are all feeding into that deliberation with respect to the steering groups. Those are discussions that are taking place, but no determination has not been made.
Thank you, Mr. Speaker. Second question.
You
Yes.
just,
Now, at page 21, and indeed it was part of your previous answer, is this idea of core care benefits package. Now, I understand that that is a work in progress, and you've referred to the timeline, and indeed July 2024 is the timeline for that announcement. But the question I have is this: at page 21, you refer to the UHC, and I quote again, Mr. Speaker, an approach comprising a, quote, thin layer of coverage for everyone. Can the Honorable and Learned Minister help us with what that means? Is there going to be a sort of two-tier here with one coverage and then a thicker coverage for others? Could you help us with that? Thank you.
thank you. Minister?
Thank you, Mr. Speaker. Again, that is a work in progress, but what is anticipated is at this point, when we work towards the April 2025 timeline, there will certainly be coverage for everyone that represents the core benefits. We will review that regularly and add to it based on our health population needs. So for the deadline of April 2025, we will have a set of core benefits that will be on offer, but again, that will be reviewed regularly depending on what our health outcome and our health needs are as a community, our population health needs.
Thank you. Supplementary and new question?
Yes, supplementary.
Yeah.
To the Honorable Minister, and again, I appreciate this has not yet been decided, so let me ask a sort of philosophical question. Would it not be better, Honorable Minister, for everyone to be entitled to the same measure of coverage, same level of coverage, rather than thin and versus thick, and then figure out how to pay through it through the private sector?
Minister?
Sorry, Mr. Speaker, with tongue in cheek, I'm not able to answer a philosophical question. I think I understand what the honorable learned member is asking. However, at this point, the discussions and the deliberations speak to what is core. If it's ascertained, let's say in 3 years from now, regrettably, there's another episode of something that is affecting our population health on a grand scheme, that will be something that would be considered core that will be added to that package.
Supplementary and third question?
Yes, second supplementary, I believe, on my second question. Just again on this idea of the provider. The Honorable Minister had been presenting a former government suggestion, which was the basic health care plan. This is, I understand it, a departure from that. We're not trying to use that methodology for universal health care, are we?
Mr. Speaker, if I understand the question correctly, it's not a departure. We have refocused our agenda in conjunction with the Bermuda Health Strategy. So what we recognize that we can't just devise a plan without having to strengthen our whole health system. It's one thing to offer something that's an insurance package or an insurance product, but if we, in the absence of concentrating our efforts on prevention, it's pointless. All 8 of the strategic principles of the Bermuda Health Strategy have to work in unison. They have to work in lockstep in order for us to strengthen our overall health system, which is our objective, so that we can have better health outcomes for our population.
Thank you.
Third question, Mr. Speaker.
Correct? Yeah.
Thank you, Honorable and Learned Minister. Again, just focusing on the potential provider, and I appreciate again that it's a work in progress and that you have timelines and decisions to make in the future. But you did reference the possibility of the provider being an insurer or insurers plural, presumably. You said also Quango or conglomerate. Can you just elaborate on what you envisage might look like? What would Quango look like, or what would a conglomerate look like? Thank you.
Minister, go ahead.
Thank you, Mr. Speaker. Mr. Speaker, again, that work has not been, a determination has not been made yet. This is a multi-year agenda. And the reality is that all the other jurisdictions that have moved towards universal health care, it has taken them years and years in the making. Fortunately, Bermuda is a relatively sophisticated jurisdiction with respect to our health system, so we're not anticipating years and years like other jurisdictions. The other benefit that we have is that we can use best practice from other jurisdictions that have already gone ahead of us. At this point, Mr. Speaker, I would be speaking out of school if I was to definitively say who the provider is for the benefits package.
Thank you. Supplementary?
No, only to thank the Honorable and Learned Minister for her answers. Thank you.
Thank you. Thank you, Minister. That brings to a close the questions to you on any of your statements. We'll now move on to the Minister of Education. Minister of Education, MP Jackson, would like to put a question to you.
Good morning, Mr. Speaker, and thank
Good
you.
morning.
I have a A couple of questions for the Minister of Education. And first and foremost, I just wanted to ask whether the honorable member might be able to just give us an update on whether any of the IT systems in the school were impacted by the compromise that we were experiencing.
Was that included in the?
On page,
Member?
on page 6,
Okay, does it
on
speak
page
to IT?
6, there's just mention of the IT supports,
Member?
such as the
Member?
Power School account.
Yes. He, talk to me.
Yes, Mr. Speaker, I just wanted to make sure, just ask whether any of the schools and the schools' web-based programs and such have been compromised.
Minister?
Mr. Speaker, my statement did not speak to any of the systems in that essence, but the simple answer to her question is no.
Supplementary?
No.
Opposition whip?
Oh, I do have a second question.
Oh, okay. Second question. Put your second question.
Thank you, Mr. Speaker. My other question was around the experiential learning. So yes, that's a very positive thing. But my question to the minister is whether we're looking to develop a real structured local curriculum program around experiential learning so that there's going to be sort of some structured formal programs as well as the field trips and such.
Minister?
Mr. Speaker, there are already structured programs around experiential learning, so the answer is yes. And I said in the statement that we will continue to develop them even more.
Supplementary?
Third question.
Third question?
Thank you, Mr. Speaker. My third question is just around the maintenance. On page 1 over into page 2, the minister was just saying that, yes, there's an increased workload, there are resource constraints, and lapses in coordination. Given the fact that we are going to be closing additional schools and that the reform will go on for a number of years, I'm wondering if the minister might be able to give us just a brief overview on how we might be able to better coordinate the work overload and resource constraints so that we're able to more smoothly roll out when the new schools and new parish primary schools come online.
Minister?
Thank you, Mr. Speaker. Mr. Speaker, as I've stated on numerous occasions, the idea of us doing this in phases is so we learn from what we've done in previous phases and apply that to phases moving forward. So the answer is yes, there is a process in place of analyzing what we've done and how we will do it moving forward.
Thank you. Supplementary?
I'd just like to thank the minister. Thank you.
Thank you. Minister? Minister, the opposition whip would like to put questions to you as well.
Thank you, Mr. Speaker. On page 3 at the top of the page, you mentioned about that you are not under any illusions, but then you continue to say that the opposition mentioned that no schools were ready for September the 11th. Can you let us know when exactly that was stated, that no schools were ready for September the 11th?
Minister?
Mr. Speaker, and I'm trying to find exactly which part the honorable member is referring to. If you could say which, can you let me know which?
You know which
part of
page
the-
he should be looking at? Yeah.
Sorry, page 3,
Page 3.
Page 3, we're on page 3,
at the very top,
at the very top.
and that no schools were ready. The opposition said that no schools were ready.
And I said, you're saying where I say, under no illusions as to the nature of the opposition and their supporters' comments that attempt to paint a picture of dysfunction and that no schools were ready for September 11th. Mr. Speaker, there were several statements made in social media, in the daily, stating that how could schools not be ready? And the implication was that no schools were ready when you do read that. So it's just a matter of interpretation. We interpret it as that was the inference that was said by those particular statements.
Thank you, Mr. Speaker.
Supplementary, right?
Uh,
Yes.
Well, yeah, supplementary. I'll rephrase my question. You mentioned that the opposition, the nature of the opposition and their supporters. And in that statement, you say that the opposition said that there were no schools. Can you tell me where the opposition said that no schools were ready for September the 11th? Because it was never said.
As I stated, Mr. Speaker, the inference was given on numerous statements that were made that gave the feedback that came back to us that why are people saying no school, the schools are not ready. So actually just saying schools not ready, that's the inference that we're drawing from.
Okay, I think the clarification is there could be opposition in the community, and that's one thing, and then it could be the opposition party. I think what the member's trying to clarify, did the opposition party say that, or did the opposition in the community, the members of the community say it? And that's the only clarification. If the opposition party said it, there's action to be pointed to where they stated it officially. If it was just members of the community, there's members of the community and not the official opposition.
Okay, Mr. Speaker, I will quote from an op-ed done by Shadow Minister Ben Smith, where he says, and I quote, "There's no reason for any school in the island not to be ready and fully functioning this year." Those are the types of comments that have taken to state that no schools are ready.
You clarify what I was seeking, that it did come from a member, or did it come from a member of the opposition or a member of the parliament?
And if the opposition member would like, I could table this printout from the Royal Gazette from that member's statements.
Supplementary?
Second question.
Second question?
Yeah, thank you. Thank you, Mr. Speaker. Considering the honorable member on page 7 mentions about resolving the many issues and also brings up the BUT. And I must say, the minister's laid out quite details here, which is I'm grateful for as to the approach. Has he had any feedback now since the opening of schools as to the progress that the BT feels is being made by the ministry to help resolve many of these issues? Has the BUT responded to his approach?
Minister?
Mr. Speaker, as I said, the commissioner is in the process of reaching out to the BUT. They had a meeting in the office between the executive and the commissioner as of Thursday. I do not have any updates on that. As you know, we've been dealing with other technological matters that have occurred since then. But the idea is that will continue to meet with the Bermuda Union of Teachers as well as other stakeholders as we move forward. I know my office myself has set up standing meetings with the executive of the BUT that we attend, myself and the permanent secretary attend. There's the JCC meetings that occur on a very regular basis with the Bermuda Union of Teacher executive and the commissioner and the permanent secretary and other officers. So we'll continue that dialogue and we'll continue to attract. What I did want to say is that the ministry will provide whatever supports are needed so we can get to that place where it's the conversation and information is flowing much more freely than it may have done in the past.
Sure. Supplementary or?
Yeah, supplementary.
Go ahead.
Thank you, Mr. Speaker. And again, the minister outlines some details, which is very good actually for the public to read, of how he's addressing the issues. One of the issues that was not addressed was where the BUT mentioned about their concern of leadership. Has that come up since the opening of the schools?
Minister?
Mr. Speaker, I would like for the member to point out in the statement where I spoke to the BUT talking about leadership of the Department of Education.
It is not covered in the statement I was presenting. Okay. Do you have a further supplementary or question? Okay, thank you. Thank you, Minister. And the final statement this morning is from Minister Furbert, and Minister Furbert must have questions for you as well. Opposition Leader, would you like to put your questions to Minister Furbert in reference to your statement on the homeless plan?
Yes, thank you, Mr. Speaker. Would the Honorable Minister please clarify how long she's been having the meetings with the charity Home, these monthly meetings?
Minister?
Sure. Thank you, Mr. Speaker. We have been collaborating for the past 3 years, but in the paper, as far as the advisory panel is concerned, we've been meeting since June, and that's indicated in the statement.
Supplementary?
No supplementary, but,
Second question?
well, clarification from the minister, I suppose, on supplementary. She just mentioned the advisory panel. I thought the statement had said may, but,
Yes, Mr. Speaker, apology, May.
okay,
Okay.
thank you. Second question, please, Mr.
Yes.
Speaker. Note the honorable minister's statement includes on page 5 a number of recommended actions that will go towards the work plan, and that the honorable minister is looking forward to sharing the work plan. Would the minister be able to state when the work plan will be shared publicly?
Thank you. Minister?
Thank you, Mr. Speaker. We are continuing to work on the work plan, and we're anticipating probably before the end of the year, Mr. Speaker.
Okay. Supplementary?
Yes, please, Mr. Speaker.
Yes.
Supplementary, the work plan, will the work plan include costs associated with this project?
Mr. Speaker, the work plan is a guidance document on how we will produce a strategy for homelessness. The work plan will identify lead stakeholders as well as areas of priority. We will continue to work through the strategy as far as action and implementation, as far as costs are concerned, but this will be a guidance document on how Bermuda will strategize the end to homelessness.
Supplementary?
Yes, thank you, Mr. Speaker. Does the work plan, or does the minister anticipate any costs on a going forward basis as yet?
Minister?
Thank you, Mr. Speaker. Not at this time.
Those are two supplementary. You got a third question?
None. Thank you, Mr. Speaker. Thank the honorable minister.
Thank you. Minister, MP Pearman has indicated questions. Would you like to put your questions now, MP?
Yes, thank you, Mr. Speaker, and thank you, Honorable Minister. Honorable Minister, I'm really pleased to hear this statement today. I believe that our island can and should solve the problem of homelessness. And again, I think that is something that all of us in this House should work towards. And I would like to commend you for getting involved more actively, both with the advisory panel, which I think was in June, and with Home, which I think was in May. So there were 2 different months mentioned in your statement, but it matters not. The people of Home are doing marvelous work, and I'm incredibly supportive of them. My question is just really on the House. You did reference in your statement the former Minister of Social Development and Sports, who I see is in the chamber today, and his efforts in relation to Bishop Spencer some years ago. And really that's not really a viable alternative on the way forward, as I understand it, because I'm not sure it's still a government property. And I see the minister is nodding her head to confirm that point. So what is the idea? I appreciate you are meeting. I appreciate there's a plan being formulated. Do you have a goal in your mind that would be the achievable outcome, other than merely the question of end homelessness, in terms of the how, the practicalities? Thank you.
Sure. Mr. Speaker, there are many components that we can appreciate as it relates to the goal of ending homelessness. And I believe that our government has demonstrated many initiatives. The honorable member speaks to the Bishop Spencer Center, and I spoke to this in my statement, that the Salvation Army facility on North Street has been significantly upgraded, and that has been in the public domain. And the government also has made a commitment, housing-wise, to produce to produce housing options for persons in our community. But the plan deals with many aspects of homelessness. That I spoke to a little bit within the ministerial statement, but I'm looking forward to sharing the more detail on the actual plan that we're hoping to have completed by the end of this year.
Supplementary, thank you.
Supplementary, okay.
Yes, still sticking with the question of how. I think we can probably agree that the plan and the proposal by the former minister who's in the chamber in relation to Bishop Spencer was a plan and a solution on a much different scale than what happened eventually with the Salvation Army. And I'm just wondering, is that still the goal that we are trying to achieve? I mean, I commend it, and I did commend it, and I commend the honorable minister for his previous efforts. Because there is a big difference, right? And so again, what is the how that you see as the outcome here? If possible, it may not be achievable. What is the outcome here?
Minister?
Thank you, Mr. Speaker. I did mention to the honorable member, I'm looking forward to sharing those details in the plan when that time does come. We're speaking to one measure of addressing homelessness. I hear the honorable member speaking to, which is the issue of housing, but there are also different levels of housing. There's emergency, there's transitional, there's temporary, there's permanent housing. And again, I look forward to sharing how, and then there's the whole coordination piece of dealing with the homeless population and also the causes. So I don't like that we're focusing in on one area. There are many areas which we need to keep our finger on the pulse, and that this government is committed to keeping our finger on the pulse as it relates to homelessness in Bermuda.
Supplementary or second question?
It can actually be a second question or supplementary.
question?
It's on this notion of emergency housing, and this was something that
So
came up.
Second question?
Second question.
Okay.
This is something that came up in the wake of the recent hurricane. And the honorable minister will be aware that Senator Robin Tucker of the OBA raised the issue of the government homeless shelter being closed for the hurricane. And the honorable minister, who I see sits in the House, the chamber this morning, of Works and Engineering, responded that the reason it was closed was owing to the level of the wind policy. My question is this to the honorable minister. Given that that was quite a storm to have the shelter closed, and given we wouldn't want that repeated, will that policy be revisited? Thank you.
Minister?
Thank you, Mr. Speaker. I am satisfied that the acting minister at the time of national security gave a very involved public statement in regards to the decision-making tree of the emergency shelter, or the use of the emergency shelter at the time. And I also want the listening community to know that the team was ready to mobilize at any point for an emergency shelter. But that was a decision with the EMO team, with national security. But we were ready to mobilize if the need arose.
Supplementary or new question?
Yes, supplementary. So I'm not looking backwards. We had the answer from the minister. He said that he acted as he did in accordance with existing policy. My question is, are you going to revisit the policy and consider amending it? Because it did seem as if the policy was inadequate in the circumstances.
Minister?
Mr. Speaker, the team did have a debriefing, and they will make consideration. They have made consideration during their debrief.
Second sub or third question?
Neither. Thank you, Mr. Speaker. Thank you, Honorable Minister.
Thank you, members, for your participation. That brings us to a close of the question period this morning. We'll now move on, just one sec. We'll now move on to the next order on the order paper. The next item on the order paper is congratulations and obituary speeches. However, members, before I acknowledge anyone, there was something that should have been done this morning at the start, but due to all the amendments around the technicality to get us here, it was overlooked on my behalf. We should have started this morning with a moment of silence to acknowledge the passing of one of our former members, Mr. Stanley Morton, who passed while we were away from this house. So I'm going to ask that you all join me in standing this morning as we take time to acknowledge that passing and give reference and honor to Mr. Morton for what he done for his country. And the moment of silence will begin, and then we will do the traditional obituaries and congratulations. Start moment of silence at this moment. We'll start now. Thank you, members, and it will be duly noted. Now we're at the condolences and congratulations. And MP Simmons, I noticed that you had rose to your feet quite early. Would you like to have your 3 minutes?
Yes, sir. Thank you, Mr. Speaker.
right ahead.
I'd like to join everyone in sending condolences to the family of former member Stanley Morton. Very kind to me and my father as a young MP in the 80s, so he will be truly missed. But on a further sad note, I'd like to acknowledge the passing of a giant
Yes,
freedom fighter, a
yes,
member of the progressive group, Brother
yes,
Gerald Harvey, passed
yes.
just shy of his 100th birthday.
Yeah.
All members of the House, I'm sure, would like to be associated
Yes.
to someone who participated in transforming our society for the better.
Mhm.
I'd also like to acknowledge the passing of Brother Andrew Phillips of Dredden Baja
Mhm.
and the East Meets West charity, and all would like to be associated with that as well, and for his contributions to society and through his charitable and entertainment endeavors. Also, we've had the passing of Miss Josephine Matthews, originally from St. Kitts. She made Bermuda her home, and
Mhm.
I think in our community, she was known undoubtedly for her bountiful generosity. We also have had the passing of Ms. Grace Elizabeth Marshalline Smith of Marcy's Dressmaking and Alterations. But I think for my family on Stewart Lane, she'll always be remembered for her kindness, community spirit, and neighborly attention to those around her.
Yep.
We've also had the passing of Dr. David Barber. While Bermuda was not his place of birth, he made Bermuda his home. And while many know him for his contributions to medicine, he made a tremendous impact on the lives of many young Black men in terms of introducing them to fishing. And he took a great interest in our society, and we owe him a debt of thanks and send condolences to his family. And on a positive note, I'd like to thank two of my constituents, Tarika Chumley and Tarun Fubler, on the starting of the Aqua Wonderland at Ireland Rangers, and further congratulate them on the selection of their son, Tyree, who was selected to play young Clyde Best in an upcoming docudrama. Thank you, Mr. Speaker.
Mhm. Thank you. And remember, Minister of Education, you have your 3 minutes.
I was looking to other people standing up, Mr. Speaker.
No,
Mr.
you rose
Speaker.
first. I'll acknowledge you.
Mr. Speaker, I'd like to start with condolences to the family of George Miners, who unfortunately passed away on Monday. He's father to a few of my relatives and to some special friends of mine as well. But I'm sure if MP Fogo was here, I would like to associate her with that as well. Mr. Speaker, I'd also like to send congratulations to the opening of schools. We just had that conversation, but especially the opening of Purvis Primary and Francis Patton Primary, Parish Primary Schools. I attended both. They had wonderful opening ceremonies at those particular schools. The parents were excited. But one thing we did see, Mr. Speaker, was standing room only in the assembly halls, which is a good thing. Because it shows that our school, despite some of the comments that we are having out there are actually more students in the Bermuda public school system today than they were at the end of the school year last year. We do always hear the statements of people leaving and people fleeing the system, but we do actually have more children in the system this year. So it's a testament to the things that we're doing and parents seeing that. I'm always, it leaves me smiling when we leave a place and you see a parent who said, I brought my child back from private school because I see what's happening within the school system. Mr. Speaker, I'd also like for a hearty congratulations and happy birthday sent to the Reverend Kenan James Francis, who turned 95 this week. He is, if you see him, you would think this guy is like 60 something. He still drives, he still gives his sermons. And he's just a wonderful person to talk to. When I picked up the phone and called him, he was like, "Hey, I'm having breakfast, so give me a call later." But he's a special friend of mine. I would just like to send congratulations to him on his 95th birthday.
Amen. Minister Furbert, you rose quickly. You have your 3 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I definitely like to be associated with the condolence of Mr. Morton. You remember one of his most famous speeches in this honorable house was, I want it and I want it now.
Yeah. Yeah.
And Stanley was a great gentleman who I think we all got along with during that time. Mr. Speaker, it's hard for me to speak on the months of deaths I've seen in Hamilton Parish.
Mm-hmm.
It has hit home. I'd like to bring condolence to the family of Carla Mae Hill,
Yes.
my relative of mine in Hampton Parish. Associate the whole house with
Yes.
this remarks. Great individuals, definitely great support of Bayless Bay. Cricket, she was the sister of Ricky Hill, who played for Somerset, and so eventually she supported Somerset and her brother. But also Corey Hill.
Yeah.
Also like to also bring not condolence, but remembers regarding my brother-in-law who just died last week. His name is Arthur Leroy Robertson.
Take your time, take your time. Take your time. All right.
I'd like to also bring congratulations to Bermuda Air for the first Bermuda airline who's actually set up in Bermuda as far as flying for passengers. They'll be flying out of Westchester, flying to Westchester, Boston, and they've got a flight coming, another plane coming in this week, which will be flying to Fort Lauderdale, Florida. I believe it's the 22nd of September. So that members of the Honorable House would like to also be associated with that. They are doing some great things. They've hired a significant amount of staff right now. I know they've got 6 Bermudian flight attendants on board. The first one that was trained, in fact, was Chris Ferbert's daughter. They've been sending them to London for training. We'd like to wish them all the best. There's going to be challenges, I'm sure. But I'm asking the Bermudian people to give them as much support as possible. They will be also, come November, turning the regular seats into what they call business flight seats. So, Mr. Speaker, that's all I have to say right now. Thank you.
Thank you, member. Does any other member wish to make a MP Ming?
Good afternoon, Mr. Speaker and listening audience.
Yes.
I start my comments today on a sad note as well. I'd also like to be associated with the comments for Mr. Stanley Morton, but I'd also like for us to remember former Senator W. Michelle Simmons, who passed away during this time, and I'd like to associate the entire house with that as well.
Yes.
Former Senator Simmons had become one of our walkers in our Saturday morning walk, and to believe it or not, at her tender age of 70, most of us could not keep up with her. So she is truly being missed at this time. I'd also like to give thoughts and prayers to the family of, I named Coden B. Kirk Butterfield, which was the former Minister Lolita Butterfield's son. I'm named Kirk since I was 14, probably hanging out in a place I wasn't supposed to be.
Well,
but it is what it is. And we've always had great conversations over the span of our lifetime and about our lives. I'd also like to extend thoughts and prayers to my own family, because my cousin John Sinclair Bubbles Fresh, however way you knew him, passed away on the first day of Cup Match. It's symbolic of him. If you knew him, he is larger than life anyhow. So to go on a public holiday seemed like that would be so him in terms of us remembering, because I'm sure our first days of Cup Match will never be the same. On a much happier note, Mr. Speaker, I would like to give happy birthday greetings to, if I said her full name, I know she would berate me. So Dolores Simon, she celebrated her 70th birthday. She's one of my constituents in St. George's, who also happens to be a very good neighbor. And I'd also like to give congratulations to Donna Rayner for being elected to the World Athletic Council.
Yes.
The first Bermudian to do so, and not an easy thing to do. So we'll keep her in prayer, and I'm sure she will represent our island well. And also to Linnell Williams, who was the first female match referee for Cup Match. It's unfortunate that she's a Somerset supporter.
Well, you know.
But
only team to support.
Just that she showed that women
Only
are still
team.
making headway even in male-dominated things. So I just say watch this space, because I truly do believe she's opened the door for other women. And also from a business standpoint, congratulations to Paul Simons on his recent promotion to CEO of Convax. And he is Bermudian, has been in the industry for quite some time. So we wish him well as well.
Thank you, member. Minister Weeks, you have your 3 minutes.
Thank you, Mr. Speaker. Good morning to you, colleagues, and the listening public. Mr. Speaker, I'd like to start off by associating myself with the remarks for Brother Stanley Morton. I've had the distinct honor, Mr. Speaker, of following in his leadership. He was the MP for the area that I now represent. I also came up with his family, his children. So Mr. Morton was a real guide and mentor, not only to me, but for those that was in the area. A lot of us want to be like A. Stanley Morton, that had the courage, Mr. Speaker, to stand up at a time when it was not popular, for Black men, especially in the 60s and 70s, to stand up against the racism that we had endured. So hats off to Mr. Stanley Morton and to his family for supporting him all those years when he made such a sacrifice. Mr. Speaker, I would also like to be associated with the remarks for Kirk Big B Butterfield. And condolences been sent to his mother, D. Nalita Butterfield, JP, MBE. She too was like a mentor to me. Kirk Butterfield was a Western Stars, Dandy Town man through and through, Mr. Speaker. So his passing, his tragic passing was sent reverberations through the Western Stars, Dandy Town, Pembroke West community. Mr. Speaker, I would also like to be associated with the remarks for Carla Hill. Carla Hill was a long time employee of the Bermuda Customs, Mr. Speaker. They are like a family, and when her death occurred, it really affected them as the Customs family. But Mr. Speaker, I'd like to end on a lighter note. I want to send congratulations to the firefighters, Mr. Speaker. Mr. Speaker, just recently, and I'd like to associate everyone in the House. Recently, we promised that we were going to hire firefighters to work at the airport. 23 firefighters have just graduated. I pledge to bring a ministerial statement here next week, Mr. Speaker, to talk more in depth. But for those 23 firefighters, some men, some females, they done a good job, and as they went to Newcastle for training, and they will be starting very soon as Bermuda's new firefighters. Thank you, Mr. Speaker.
Thank you, honorable member. MP Pearman, you have your 3 minutes.
Thank you, Mr. Speaker. I rise today to give condolences, both personally and on behalf of the One Bermuda Alliance, on the passing of Eugene Talbert Vic Ball, who was the father of OBA candidate Vic Ball. I went to Mr. Ball Sr.'s funeral, and I was delighted to see that not only were there representatives of the One Bermuda Alliance there, but there were a number of representatives from the Progressive Labor Party there as well. I see one in the chamber. MP Derek Burgess was there, and others at the ceremony up in the Southampton Seventh-day Adventist Church. Mr. Ball Sr. was a firefighter. He was a star player for the Devonshire Colts, and he was an incredibly competitive, as we learned through a number of eulogies and speeches, incredibly competitive cyclist who really was going full at it well on the bike. As I was preparing to rise to offer my condolences to Vic and to his family for the passing of his father, I understand from MP Renee Ming, who was asked to be associated, that indeed Vic's aunt, Chanel Anne Marie Ball, has also recently passed, and indeed her funeral will be tomorrow at 11 a.m. at the Church of Christ in Brighton Hill. So I would like to associate Ms. Ming with those condolences as she had to step out of the chamber. Additionally, Mr. Speaker, I'd like to offer condolences both personally and on behalf of the One Bermuda Alliance to Tariq Smith and his family who have lost his grandmother, Betty Ernestine Smith. She was a constituent of mine, and I attended her funeral at St. Paul's in Paget. She was a remarkable woman, and I had to canvass her house many times, and it was not a short visit. I would be ushered into her kitchen, and I would hear what she had to say at length. She's I hear someone would like to be associated. I see, yes, MP Neville Tier would like to be associated. Yes, she had very famous at making her scones, and she used to go out and ensure that she got her seat for the 24th of May. And apparently she sent her boys out, her grandsons out at midnight to secure that. So well before even people were setting up for the parade. She was a remarkable woman, a woman of passion and opinion. I also heard and learned for the first time at the service at St. Paul's that she took up piano later in life. And while she may not have been tremendously adept at it, she was certainly diligent, and she would invite her family members after lunch to hear her progress on the piano and to sing. So, as I say, on behalf of this political party and all of my colleagues, we would like to convey our sincere support and prayers for both of our candidates, OVA candidates, Vic Ball and his family, and Tariq Smith and his family. Thank you, Mr. Speaker.
Thank you. Deputy Speaker,
Thank
you
you.
have your 3 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I would like to be associated with the remarks of the Honorable Member Stanley Morton. Mr. Morton is one of the shoulders that I stand on today, and I appreciate his contribution to this country and where we are today. Mr. Speaker, also the Honorable Member Nolita Butterfield's, former Honorable Member Nolita Butterfield's son, we send condolences to that family. Mr. Speaker, also Ms. Carla Hill, a very well-known figure in Hamilton Parish and Bayless Bay, certainly to the Hamilton Parish football and the Bayless Bay cricket team. She was always there. A very strong family person. As they tell me, she was the glue of that family. And I know she'll be sorely missed by her son, mother, and father, and brothers. Mr. Speaker, also I'd like to send condolences to the family of Vic Ball. Vic Ball Sr. was a personal friend of mine. We've been friends ever since we went high school together, Mr. Speaker, and we kept that friendship until his death, Mr. Speaker. Mr. Speaker, Mr. Ball, who served in the fire service for over 30 years and gave exemplary service to the country, and as was announced and displayed, repeated many times at his service, Mr. Speaker. His son, my godson, Vic Ball Jr., and his daughter, Georgina, and the grandchildren, he will be sorely missed by his wife, Elizabeth. Elizabeth is also from the great Hamilton Parish. He came down and got her, and that's what made him such a great football player who as you can remember that Vic Ball was always keep the Somerset star Randy Horton at bay when Devonshire Colts played Somerset. Vic Ball was stationed to take for Randy Horton,
He
and
was slotted, but Horton got by him. He was
and
slotted.
Randy got crossed, but the ball had already been kicked outside. But Randy Horton would remember Vic. He was a competitor. He was hard. He was strong. And he would certainly be sorely missed by all that knew him. Thank you, Mr. Speaker.
Thank you, Deputy. MP Fogo, would you like your 3 minutes?
Thank you, Mr. Speaker, and good afternoon to the people of Bermuda. Mr. Speaker, I would like to be associated with the remarks regarding former senator and educator and principal par excellence, Michelle Simmons. I'd like to associate Minister Weeks. I would like to associate.
We associated to Hill House.
I will
and
associate
Senator
the
Meehan-
Hill
Well,
House.
Senator Meehan associated to Hill, MP
Here-
Meehan.
she did.
Yes. she
Okay, you're
associated to
welcome,
Hill House.
Mr. Weeks. Yes, Michelle, with her service as an educator, coupled with her service as a senator, she gave much to Bermuda. I would like to congratulate and be associated with the remarks regarding Donna Reyna in terms of the position she now occupies internationally when it comes to track and field in particular. I would like to give congratulations to Bermuda Air. And I hope that we have much success as a Bermudian airline. It would be remiss of me, being on BAA board, not to provide congratulations. Mr. Speaker, I would like to provide congratulations to Miss Natasha Trott. I'd like to associate MP Renee Ming with these remarks. Natasha is our first Bermudian referee assigned to officiate on CONCACAF games. Bermudian female referee, yes. You know, that's no easy feat. And she is a FIFA assistant referee as well. So I look forward to her success in that realm. And in serving in that capacity, she will be an ambassador for Bermuda. And last but not least, Mr. Speaker, I think the whole House may know of Mr. Malcolm Ming. He is probably older than quite a few people. His years of service as a barber is more than the age of quite a few people in this House. The majority of the people in the House, having been a barber for 55 years in St. George's. At 80 years old, Malcolm Ming, who is a back of town St. George's boy, who grew up with my brothers, right? A back of town St. George's boy, decided to throw in the towel, right? But again, many young men can attribute their sharp haircuts to the hands of Malcolm Ming, okay? Remember, I just want to say this. St. George's is the first city in Bermuda. Back of town belongs to St. George's first.
All right, MP. Does any other member wish to make a contribution at this time? Any other member? Colonel, Minister Birch, you have your 3 minutes.
Mr. Speaker, good afternoon.
Good afternoon.
I'd like to be associated with the condolences to Mr. Gerald Harvey from Somersby.
Yes.
I extend condolences to his widow and his 2 daughters. On a happier note, Mr. Speaker, I attended the 80th birthday celebration service for Mr. Kelly Zoo on the 20th of August at St. Anne's Church. I've known Kelly all of my life. I grew up listening to him first thing in the morning on the radio on Gospel Train.
Yes.
And I've listened to him for, I think it's 60 years, he's been a radio announcer.
Yeah.
It was actually a very special service that he participated in, and he brought in a number of people to help him celebrate it. He wanted to hear music, so he had people who came and sang and participated in the service. And so I'd like to extend warm congratulations to him on his 80th birthday and his 60th anniversary as a DJ. Thank you.
Does any other member wish to make a contribution at this time? MP Jackson, you have your 3 minutes.
Thank you, Mr. Speaker. I would just like to send condolences to the family of Grace Fox. She was a constituent I really enjoyed visiting. She also was known to me in my younger years because she made her professional career at the Bank of Bermuda and then HSBC. She has 2 wonderful sons, Bruce and Stephen, and I wish them the most sincere condolences, and certainly she will be a miss. I'd also like to send condolences to the family of Frank Chiappa. He has passed away most recently, and very sorry to hear, but I do understand he's not been well for a while. Thank you.
Thank you. MP Cannoneer?
Yes, thank you.
You have your 3 minutes.
Thank you, Mr. Speaker. I'd like to be associated with the condolences coming from Minister Furbert on his brother-in-law and to his wife and their siblings on the passing of Arthur Robinson. I got to know him. I knew him from young, but I got to really know him in the last maybe 12 years. And this guy was well, he didn't live next door. I thought he lived next door because he was always next door in the shed of Tommy Harvey, who lives right next door to me. And he was always cooking. I mean, this guy was cooking for everyone. And so a very spirited young man and made no qualms about letting you know where he stood with issues. So in later years, of course, having to get to know him and then found out he lived in constituency 8 and canvassing, we had the opportunity to meet him. And it was kind of sad to see, you know, this plague that we have called cancer is just horrific. And to see him still spirited and what he, you know, how he felt about things, but to see that he had passed away was quite heartfelt. So to the minister, condolences to you and the family for sure. On another lighter note, of course, Malcolm Ming cut my hair. So a lot of the St. Davis people went over to see him over in St. George's. So if he saw my head now, he'd be very upset because I had a haircut in so long. But what a stalwart of the community for St. George's and St. Davis. Kudos to him. He must be, my goodness, he must be
80 years old.
Yeah, at least. This month. And on another lighter note, Mr. Speaker, just for the honorable member, JPMP Susan Jackson, it's her birthday today.
All right.
So we want to say happy birthday to her.
Happy birthday. All right.
Thank you, Mr. Speaker.
Okay, thank you. Does any other member wish to make a contribution at this time? No other member? Before we move on, I'd just like to add a couple of words to the remarks that have been made today. And I'd first like to associate myself with the remarks that have been expressed to the Harvey family on the passing of Mr. Gerald Harvey. Mr. Harvey, has already been stated, was a pillar in this community in many different ways. He was a man of substance, he was a man of principle, he was a man who quietly fought to bring change into this country, along with the other members of the progressive group. I've known Mr. Harvey all my life. His children, his daughters, Donna and Lisa, childhood friends of mine, have been in and out of the house. And it wasn't until it was finally announced publicly that I even knew he was associated with that movement. But it's the type of man he was. He was very quiet in his own way, but very meaningful in his contribution. And his passing will surely be missed by the family and the community. And as noted, he died just shy of his 100th birthday. And what a milestone that would have been for him to have accomplished. I'd also like to be associated with the remarks to a former classmate who were at Berkeley together, Ms. Donna Rayner, on her accomplishment in the international space in the Olympic sport and governing body. And I think it's a great accomplishment, not only for her, but help put Bermuda on the map as well. And lastly, be associated with the condolences to the family of late Senator Michelle Simmons. And as the remarks have been said about the contribution she's made publicly as an educator, as a senator, speaks highly of who the person was, who she was, and her commitment to the country. And on a lighter note, I too have walked with her, MP Ming, in that walking club some mornings. And yes, she always tried to set a pace for those behind her, but she will be missed, and we express our condolences to her family. With that said, we'll now move on. The next item is matter of privilege. There are none. Personal explanations. There are none. Notice of motions for the adjournment of the House on matters of urgent public importance. There are none. Introduction of bills. There are some 6 government bills to be introduced this afternoon. And the first is in the name of the Minister of Finance, and I think Minister Campbell, rather, will be introducing that.
Yes, I will.
Yes.
Mr. Speaker. Mr. Speaker, I am introducing the following bills for the first reading so that they may be placed on the order paper for the next day of meeting. The Trademarks Act 2023 and the Trademarks and Service Marks Regulations Amendment and Validation Act 2023. Thank you, Mr. Speaker.
Thank you. The next is bill to be introduced is in the name of the Minister of Health. Minister?
Mr. Speaker, I'm introducing the following bill for their first reading so that they may be placed on the order paper for the next day of meeting, namely the Health Insurance Amendment Act 2023.
You. And the next three are in the name of Minister Hayward. Minister?
Mr. Speaker, I am introducing the following bills for the first reading so that they may be placed on the order paper for the next day of meeting. The Financial Assistance Amendment Number 2 Act 2023, the National Training Board Amendment Act 2023, and the Employment Protection of Employee Tips and Gratuities Amendment Act 2023.
Thank you, Minister. There are no opposition or private members' bills. No notice of motions, there are none. That now takes us to the orders of the day. And the first order on the paper today is the second reading of the Distillery Licensing Act 2023, and that's in the name of the Minister of Tourism and Minister for Tourism and Cabinet Officer, Minister Campbell. Minister, you have the floor.
Mr. Speaker, I was advised that, you were advised that we were going to carry that over.
Okay, you wish to carry it over now?
Yes, we'd like to carry that over to the next meeting.
Okay, all right.
Thank you, Mr. Speaker.
We'll move on to the next item. This is the second reading of the Motor Car Classic Car Amendment Act 2023 in the name of the Minister of Transportation. Minister?
Thank you, Mr. Speaker. Mr. Speaker, I move that the bill entitled the Motor Car Classic Cars Amendment Act 2023 be now read the second time.
Are there any objections? There's a dress code for members coming in. Yeah, give us something on. He needs a coat and tie. Yeah, he needs a coat and tie. Where's Sergeant here? Sergeant only has a coat and tie he would get for him. Look in my closet right there. I have a jacket and a tie in there. Tell him put on jacket and tie and then come here. Okay? Terry, sorry, Terry. Yeah. Tell both of you, but I'm letting you slide, but Terry's got to get the jacket and stuff. So she let her go. Come on. But Terry's the one I'll be with me. Yeah. Terry. I keep a jacket and tie in there. He'll get it and put it on Terry. Terry can come here. Okay? Sorted out? He said it's funny. You want him? He can put it on you there. There's a jacket and tie that you keep it for that. He was happy not to come. Okay. All right. Minister?
Thank you. Again, thank you, Mr. Speaker. Good morning, everyone.
Yes.
Mr. Speaker, the bill presented today before this honorable House is the Motor Car Classic Car Amendment Act 2023. And the purpose of this bill is to permit the importation of classic cars to Bermuda, prescribe the license fee and import duty payable on classic cars, and provide the specific days classic cars may be used on Bermuda's roads. Mr. Speaker, the allowance of classic cars in Bermuda is not new. We have allowed classic cars for about 30 years. I know it, Mr. Speaker, because I was the Minister of Transport at that time. Since that time, we've been operating basically on the concept of policy. This particular bill puts it in an act, and in addition, Mr. Speaker, adds on one more day that a classic car can be driven. Mr. Speaker, a Transport Control Department TCD policy dated way back May 21st allowed residents who own private motor cars that have been registered for a minimum of 25 years to convert them to classic cars. These vehicles also must have been licensed for a minimum of 15 years. Mr. Speaker, although this policy permitted the registration, licensing, and using of qualified vehicles on Sundays and public holidays, This bill, as I mentioned, puts it in legislation to be clear and be more enforceable. Mr. Speaker, there are currently 17 private motor cars registered and licensed as classic cars in Bermuda without the supporting legislation. This set of circumstances, coupled with the inability to import classic cars, led to a policy review. This bill addresses current practice, and the importation of a classic car will now be defined as a private motor car that is 25 years or older from the date of manufacture, whether it has already been registered in Bermuda or being imported in Bermuda. It is important, Mr. Speaker, to note that only one vehicle can be driven at a time. Mr. Speaker, the original policy allowed classic cars to be driven on Sundays and public holidays only. As such, the annual license fee was set at 25% of the respective category in which the vehicle belonged. The new policy extends usage to include Saturdays. That's the only change that's really being made. It was Sundays and public holidays, and now we're including Saturdays. Therefore, the license fee has been increased to 40% to reflect the additional day. Mr. Speaker, introducing this proposal would not create impact on any supporting legislation. For example, approved classic cars sourced from overseas will be subject to this current rate duty, which is 75% of $10,000 and 150% on the remainder. There are no infrastructure modification or upgrades or other known implementation costs required for the government to enable this proposal. Mr. Speaker, this proposal has the potential to provide economic benefits that will impact the wider community. It is acknowledged that quantifying the benefits is challenging. However, it should be noted that the scale of benefits is directly related to the amount of duty, application, registration, and license fees collected for the classic cars eventually imported. A potential social benefit of this proposal, Mr. Speaker, may be the emergence of service garages offering employment to local apprentices and specialized mechanics to maintain and repair classic cars. Mr. Speaker, it can be expected that the presence of prized vehicles in pristine conditions driven on Bermuda's roads will be very entertaining. Research indicates that this is an attractive market with worldwide appeal. This proposal could lead to Bermuda's again hosting events like the ETA motorcycle rides, the recent vintage car rally that attracted many visitors to the island and participated in the Bermuda Day Parade. In conclusion, Mr. Speaker, accommodating this proposal will require only a few amendments to the legislative framework that regulates importation, examination, licensing, and registration of private cars. It will also signal that Bermuda is open for business and is accepting of new experience and encourages diversifying the products on offer. Thank you, Mr. Speaker.
Thank you, Minister. Does any other member wish to make a contribution? MB Jackson, you have the floor.
Thank you, Mr. Speaker. And I thank the minister for bringing the Motor Car Classic Car Amendment Act to the House. Although I must begin and preface, Mr. Speaker, that there are a number of challenges within the transport ministry, in particular the public service vehicles, and it's just very difficult to have to concentrate a good bit of time on a piece of legislation that really is only making one minor change, adding a day, and is really only applicable to a few people when we have a number of challenges. In particular, the taxi industry is really struggling right now. we still are dealing with a number of bus cancellations and other challenges within transport. And so it's very, very difficult for myself and for many members of the community who would like to have the ministry focus more time on legislation that will be able to support their challenges. But we're here today to talk about classic cars. But given that, Mr. Speaker, I do want to add to the minister's comments about how the classic car industry could become something more, as the minister mentioned, entertaining, and also maybe have some career aspirations within it. Not only is this classic car cottage industry entertaining, it's often really, really fun. Certainly I went to the most recent classic on Front Street and certainly enjoyed that. But there are opportunities here for Bermuda to develop a cottage industry. There are members of the classic car group, classic car enthusiasts, who really enjoy this. So it has two potential arms to it. One is that it is certainly the ability to introduce our young people to get into training, to maybe grow as a hobby, as a potential career. The assembly of classic cars, especially those that are reconditioned and really brought up to pristine state. And the other is the fact that this is an art form and that this is a part of our culture. Certainly, my favorite is the Morris Minor. I really enjoy when, you catch a glimpse of sort of old time Bermuda driving down the road. It's really an amazing sight to see. And so I don't want this classic car legislation to just stop at adding Saturdays to the times at which people can drive their classic cars, but to see whether we as a community cannot take the opportunity to really develop this. And certainly if we have a few more classic cars that are able to get on the road and are seen a little more often, and it can increase the curiosity of our young people, if it can stimulate some creativity and art form, I certainly see that as a positive. And so I would like to think that this will all contribute to the development of that. But at the same time, Mr. Speaker, we have to also realize that we are in a critical state on our roads, and we certainly have to pay attention and make sure that that what we're doing on our roads is not adding to the confusion. And one of my issues around this, and the minister is going to address it, so I'm not saying this to be adversarial, but we do have an issue with the number of cars that are on the road. And the idea that there are members out there in the community that will see this classic car as a way in, a loophole in order to have a second car in the family or registered to one address. And that is becoming an increasing loophole that I think is worth us, or I believe is worth us investigating, because not only now is it the second car, a classic car, but we certainly have a growing number of small business vans and other vehicles that are now sort of developing into that second car in the family. And to make sure that we remain diligent and vigilant to make sure that the number of cars on our road does not get to the point where we are finding ourselves in difficulty and having a real safety issue. Mr. Speaker, the community was a little concerned about, and when I say community, the classic car enthusiasts, are a little concerned about a couple of things, and I don't know enough, and so I'm asking the minister. This is about the importation of the classic cars, and at present, there seems to be some ambiguity and people are just not very clear on how one can actually, a Bermudian can actually import a car and how that process works, how they can make that application and make it work. There are enthusiasts out there, and the minister is aware of them, who are having a really hard time licensing their classic car so that it can be driven in Bermuda. And the minister mentioned that there are 17 classic cars that are on the road right now, but I understand that there are more like 50 classic cars that are actually in Bermuda but are not licensed for the roads. And so whether we are able to make that clear so that the classic car enthusiasts have a greater understanding about how and at what point they can license these classic cars so they can drive it on the road. And if the minister could explain that, that would be great. Right now, just having a look, Mr. Speaker. I'm going to just and ask this final question of the minister before I take my seat, and that is that there's also been a question that has been presented around the value of the classic cars. So if members are able to import classic cars into the island, the question then is raised that if there are cars on Bermuda, in Bermuda that are classic, but have not been licensed, or if the classic car car owner wishes to sell that classic car locally, will it lose its value? Because if somebody can now import a car at a lot less money, then those classic cars that are on the island, which always it's Bermuda, are going to be more expensive. Whether this action is actually going to devalue the local population of classic cars on the island. And with that, I have no further questions other than in committee. Thank you.
Thank you. Does any other member? MP De Silva, you have the floor.
Thank you, Mr. Speaker. Mr. Speaker, it's the honorable member opposite. You just took a seat's birthday today, so I'm just gonna be really nice.
Take her for a ride in your classic?
Yes, sir. Maybe the honorable member didn't hear the minister's statement, but I think all the questions she asked were actually dealt with in the statement. But Mr. Speaker, I'll leave that there. Thank the minister for bringing this. It was brought to my attention when I was minister, which seems to be getting to be a long time ago now. But I certainly support this legislation, this bill. And I think it's going to be great for Bermuda for all the reasons that the minister outlined. I would like to emphasize the fact that I think it does create opportunities for our young people as well. Because, our youngsters, I know a lot of people in this room, when we guys were younger, we got our bikes. We want to get chrome spokes, maybe chrome the flywheel, do this, do that to our bikes. I think it may stem some interest. Maybe we even take some of our young men off the streets, Mr. Speaker. So I certainly supported it when I was minister, and I certainly support it now. With regard to the comments that my honorable member opposite spoke about, when she started talking about some of the other issues at TCD or the roads and whatnot, I'd like to say that this government and our ministers can chew gum and walk at the same time. So whilst we may have some challenges in any one of our ministries, I'm sure that as we are seeing today, that the minister is bringing this legislation, he's got some challenges in his ministry, just like all ministers do. But that doesn't mean we stop and say, look, we don't look at other options for this country and our people. So I thank the honorable minister for bringing that here and certainly support it. I think it will have economic benefits for our people, for our businesses on the island, and also our tourist industry. So thank you, Minister, for that.
Thank you. Does any other member wish to make a contribution? None? Minister?
Thank you, Mr. Speaker. Thank you, the honorable member Zane De Silva for your support. I'd also like to thank the opposition member, which I find very interesting. Some of the questions you asked. Yeah, I found some of the questions you asked and some of the things you said as far as there's 50 classic cars out there. I would challenge the honorable member. If you can find one or two that came down to TCD and was not given a classic car, let me know. Matter of fact, we can call a press conference, you know. But no, you said, the honorable member said, they may not have done it yet. The honorable member said this to this floor, that there's people that's going down TCD and hasn't got the classic cars passed. That's what the honorable member said. And that was, you did say that. We can replay it again, but that's, you know, that's fine. Because there's no one that's been, if you qualify as a classic car, I'm sure the honorable, my good, the member director, Spencer has heard that. I'm sure he will. Also, he says about second cars, creating second cars. I thought you and I had a good discussion outside because, yeah, the honorable member was trying to encourage me to have second cars, weren't you? Earlier. Come on. Yes, you were. Honorable member was trying to encourage me to have second cars outside. And I'm saying, I'm smiling. The honorable member, I'm being open. I heard my outside kind of lay it out to the honorable member what we're planning to do in registered cars and why should we have second cars. But that's fine. I understand the political aspect of these things. But Mr. Speaker, I'm glad that the opposition supports this particular these amendments, and we will, Mr. Speaker, at this time, I move that the bill be committed.
Thank you. Deputy?
You got a bill in front of you? Okay, not a problem. Honorable members, we are now in committee of the whole for further consideration of the bill entitled the Motor Car Classic Cars Amendment Act 2023. Minister Furbert, you have the floor.
Thank you. Thank you, Mr. Chairman. And so I'm going to move, because I want to make an amendment to clause 3. So I'm going to move right now clause 1 and 2.
Continue.
The bill seeks to amend the Motor Car Act 1951, the Principal Act, to provide for the classification and importation of classic cars, to prescribe the license and import duty payable on classic cars, and to provide for specific days classic cars may be used in Bermuda's roads. Clause 1 provides the title of the bill, and Clause 2 amends Section 2 of the Principal Act to insert the meaning of classic car.
Any speakers to clauses 1 and 2? The chair recognizes the honorable member. Susan Jackson, you have the floor.
Thank you. I just have a very quick question, and this is in the citation. Can I talk about that? Number
If
1?
it's close, yeah.
Yep,
right there.
okay. I'm just curious, and it's been asked, why is it just classic cars and we're not including classic motorcycles?
Minister.
I would take that under advisement.
Any further speakers? There appear to be none. Minister, you want to move clauses 1 and 2?
Mr. Chairman, I move clause 1 and 2.
Are there any objections to approving clauses 1 and 2? There appear to be none. Approve. Continue, Minister.
Mr. Chairman, I move clause 3 with an amendment.
Continue.
Mr. Speaker, Mr. Chairman, clause 3 inserts a new section 13A, 13B, and 13C in the Principal Act to provide that a person who owns a private car that is 25 years or older may apply for a car to be classified as a classic car, subject to the application fee and any information required by the director.
One second, Minister.
Sorry.
This amendment is to do with clause 3.
13C, yes, 13C 1B.
Okay, you probably should do the amendment
Do
first.
First.
Yeah.
Mr. Speaker, I move that we revise clause 3, section 13C 1B to state, shall costs allow more than one private car registered at the same residence to be used at any time.
Any speakers to that? To the amendment? Ms. Jackson?
Thank you, Chair. Yeah, my only question would be, how are you going to figure that out? How will you be able to identify if both cars are being driven at the same time? It just seems very difficult to track that down.
Mr. Speaker, the point's taken, and we had a discussion earlier this morning regarding that. There's no different from what we have right now as far as the classic car. Remember, we've already been having classic cars. If a person is caught driving the other car, there will be a fine to it.
Any further comments on the amendment? No? Any objections to the amendment? There appear to be none. Amendment approved. Continue, Minister. Move clause 3 as amended, Minister.
Mr. Speaker, Mr. Chairman, I move clause 3 as amended.
Any objections to that? There appear to be none. Clause 3 approved with the amendment. Continue, Minister.
Clause 4 repeals and replaces section 15 of the Principal Act.
What are you doing, clauses 4 and 5?
Sorry,
6,
clause 4. I can go right to clause 4 to clause 11, just straightforward.
Continue.
Repeals and replaces section 15 of the Principal Act to exempt a person who imports a classic car from the restriction on the importation of used cars. Clause 5 inserts new section 15A into the Principal Act to provide for the importation of classic cars once classified as a classic car by the director. It provides that the owner of a classic car who wants to import that car may apply to the director for a permit, subject to an application fee. It also provides that an application shall include information regarding a notarized bill of sale containing information including the make, model, and model year and dimension of the classic car, and creates an offense for any owner of a classic car who imports or attempts to import a classic car without a permit. Clause 6 amends section 16 of the Principal Act by repealing and replacing subsection 16 to provide that the provisions of section 16 restrictions relating to ownership, etc., of private cars apply to a classic car as they do to a private motor car. Clause 7 amends section 20 of the Principal Act to include the owner of a classic car as an accepted person in the ownership and use of 2 private motor cars. Clause 8 amends section 59 of the Principal Act to insert the reference to the new section 62C in that provision. Clause 9 inserts new section 62C into the Principal Act to provide that the owner of a classic car is exempted from paying the full license duty for a private motor car in Schedule 2 in the Principal Act and is instead liable to pay 40% of the license duty provided for relevant private motor car. Clause 10 provides the transitional provision for private motor cars registered with the Transport Control Department as cars that are classics before the coming into the operation of the bill. And Clause 11 provides the bill comes into operation on such day as the minister appoints by notice in the Gazette.
Thank you, Minister. Any speakers to clauses 4 to 11? There appear to be none. Minister, you want to move clauses 4 to 11?
Mr. Speaker, Mr. Chairman, I move clauses 4 to 11.
Any objections to approving clauses 4 to 11? There appear to be none. Clauses 4 to 11 are approved. Minister, you want to move the preamble?
Mr. Chairman, I move that the preamble be approved.
Any objections to the preamble being approved? There appear to be none. Approved.
Mr. Chairman, I move that the bill be reported to the House as printed. Amended, sorry.
Are there any objections to reporting the bill to the House as, the bill as amended to the House as amended, I'm sorry, yeah.
Yep.
I'm sorry. Any objections? Agreed to.
I move that Standing Order 21 be suspended. to the-
One second, you gotta wait for the speaker on that.
Oh, I thought you, oh, sorry, yeah.
Yeah, Mr. Speaker. Your speed.
Slow down, Minister.
Members, are there any objections to the Classic Car Amendment Act 2023 being reported to the House with the amendment? There are none. It has been reported to the House with the amendment. Thank you, members, for your participation in that. That now brings us to the end of the orders that were today, because the motion that's the next item is being carried. And we'll now have our third readings. Yes?
Mr. Speaker, I move that Standing Order 21 be suspended to enable me to move the bill entitled Classic Cars Amendment Act 2023 be now read the third time by its title only.
Any objections? There are none. Continue.
Mr. Speaker, I move that the bill be now read a third time by its title only and passed.
The bill has been read a third time by its title only and is now passed. That was the only one. So, Deputy Premier?
Good afternoon. Sorry, Mr. Speaker.
No problem.
I do move that we do now adjourn until the 29th of September.
No problem. Does any member wish to speak to that? Any member? No member? Deputy Mayor?
Mr. Speaker, I wish to thank you. Mr. Speaker, thank you for the indulgence and opportunity to address the House today. I wish to speak to the House on matters of crucial national importance.
Yes.
Everyone is aware that over recent days, we've had a serious IT disruption within government of considerable impact. And I just wanted to take the time on behalf of the government to report to the House and the country the situation as it has impacted our own operations as a legislature, and obviously other important branches of government. It's important that the government and myself speak to these matters. So, Mr. Speaker, approximately 10 p.m. on Wednesday, September 20th, the government's IT systems experienced a serious cyber attack, which resulted in a disruption of services across government departments. An immediate investigation has commenced and did commence at that time by the Department of Information and Digital Technologies, and the matter was reported to the Bermuda Police Service, who also commenced an investigation. Mr. Speaker, Mr. Speaker, the Cybersecurity Committee was convened to review this matter. The Cabinet and the government, leading members of the government and Government House were apprised of the situation, and the government departments commenced work on systems containment and took immediate action to mitigate any further impact on services. We all know that most of the services of government were severely impacted on Wednesday and yesterday, and the appropriate action was taken to deal with that. Just give me a moment, Mr. Speaker. The Department of Information and Digital Technology is working closely with internal and external resources on restoration and recovery efforts to restore full system capabilities. Mr. Speaker, a fulsome review of our current service capabilities has been undertaken, and I am confident, and the government is confident, in our ability to continue the delivery of services to the community. All but we anticipate that our contingency plans to deliver services may result in some delays. More details on specific service delivery impacts will be provided later today and through the weekend. And I can assure members of this House, this is a 24-hour issue for us. Members of the cabinet have been meeting daily on this. Members of the cybersecurity committee has been meeting on this with other relevant local and international parties to deal with the situation. The government has ongoing contact with Government House, and we are grateful for support from the UK National Cyber Security Center and National Security Agency. Mr. Speaker, it is recognized that this regrettable incident will cause concern to many in our community. And we will continue to regularly update the public as more information comes available. This is a moving situation, Mr. Speaker. I do not want people to underestimate some of the sensitive security issues and even international issues that are around this matter because of the gravity of the incident. Mr. Speaker, in the hours since the event occurred, many have endured sleepless nights. The very heart of public services has been attacked and immobilized. Usually the term resilience is used to describe how we as a community respond to the recovery of a hurricane. Make no mistake, Mr. Speaker, we will recover from this. The resilience that we know our country to have is working in our favor right now. Already, we have unity and purpose, joining the public and private sectors to derive solutions to problems that would otherwise impact economic activity and our people's ability to meet their commitments. And I can assure members of the House that members of the international business community have reached out to the government and are providing support and assistance to us, as are our local banks, to assist the government with making sure that certain obligations that the government has over the upcoming days and weeks will be met. The assistance offered has come from across the spectrum and is actually quite heartening to know that this challenging moment, we can count on the assistance of key partners, both local and international. And I am confident that we will, Mr. Speaker, this is an extremely serious matter. And if members of this House, particularly opposition, are going to take it lightly, their own constituents are being impacted by this, as are every member of this government is being impacted. So I would ask that they take this for the seriousness that it is, Mr. Speaker. Mr. Speaker, government, financial institutions, large corporations, and even individual citizens have clearly been violated by this incident. Our priority is to return to normal operations as soon as possible, and we are assembling the necessary resources to achieve just that. The importance of government services to the community is magnified at times like this. And we recognize, Mr. Speaker, how critical it is and what we do. and the necessity to restore those services to the people of Bermuda. As we go through this process, I just wish to assure everyone in this House and the country that the work is being done around the clock. Many people aren't sleeping to get this rectified. And I can assure the country and this House that we will get the answers that are desired. There are still questions that we are seeking to get answers to ourselves. I would remind people this is a very delicate situation. There are international implications around some of the issues that have arisen as a result of this, which is why we're working with Government House and the United Kingdom, and we appreciate the support that we're getting from the United Kingdom and other sectors, our own international business community, and others who we have retained to support dealing with this situation. And I would hope that support for what needs to be done is embraced on both sides of the House and all sectors of the community. And we will continue to report accurately on the situation so that all parties, because we understand every member of this House has constituents that are impacted by the services of government, and those services are of necessity. And we are going to work as hard as we can to get all these services back into operation. So, Mr. Speaker, I hope that satisfies the House for now. We will continue to provide reports, regular reports to the community, and we will ensure that everybody's kept up to date on all steps we're taking with the situation to ensure that government services return to normal operation. Thank you very much, Mr. Speaker.
Thank you, Deputy Premier. Thank you, honorable members, for your participation today. And again, I express my sincere gratitude to each of you for allowing cooperating with us and allowing us to sit in the manner that we sat today and the circumstances that are before us. So I thank you for each one of you for agreeing and being here today, and ask that we continue to be unified in how we address the issue that's before government, because it really affects the country. And it's in the best interest of the country that we find a unified way of going forward and dealing with this doesn't blow up in an unnecessary format that can be better controlled and managed by us all in this place. With that said, enjoy the weekend, be safe, and we look forward to being here next Friday at 10 a.m. The House now stands adjourned.